These are some of my favorite female celebrity analysis videos from over the years. Let me know your thoughts and who I should analyze next in the comments below. And when you get a chance, head to feelconfident.com to check out our skincare and hair care products. From her early days on the Disney Channel to her current status as a pop sensation, Sabrina Carpenter has captivated us with her incredible talent and stunning looks. But many wonder, has she undergone cosmetic procedures to enhance her appearance? All estimated costs and a before and after are revealed later on, so stay tuned. In her teenage years, what we see here are high, full brows. She has nice infrabrow fullness and supratarsal show. When I look at her nose, I see a narrow nasal bridge. And her upper to lower lip ratio is about a 0.9 to 1. She does have upper tooth show on repose, meaning when she just parts her lips. And she has a strong upper and lower jaw, including a strong gonial angle, and that's the angle of the jaw right in here. What that does is that it increases the width of her lower face, and that can be caused by the actual thickness of the jaw itself, or sometimes by the muscle that overlies it, called the masseter muscle. You may have heard that some people get Botox injections into that muscle to try to reduce its strength, whether that's for helping them with TMJ pain or potentially to reduce the width of the lower face. But that muscle or its underlying bone can add to the lower facial width. In 2017, at the age of 18, Sabrina has nice youthful cheek fullness, and that fullness is more medially based, meaning closer to the center of her face. And that really works in youth, but as we get older, some people try to recreate that with filler, and it can look somewhat artificial, especially as the face starts to sag and medialize and move down. That extra weight in the medial face with filler can at times look a bit unnatural, but in a youthful state, it is very natural appearing. And I wanted to point out here that the nasolabial folds are very much present, and this is how it actually looks in a more natural state. So when people try to again use filler to efface the nasolabial folds, things can start to look a bit more artificial because you're starting to blur those boundaries, those facial subunits between, for example, the perioral area and the cheek complex. In a natural state, those boundaries are more well defined with things like the nasolabial fold that serves as the boundary between those subunits. And I also wanted to point out here what I think is a distinctive characteristic of Sabrina's face, which is that the philtral columns are not well defined. So in some people, you have quite a bit of depth to the central area of the upper lip where the philtrum lives, and you have the philtral columns on either side. In Sabrina's case, the area of the upper lip is flatter and there's less of that indentation between the philtral columns. And that gives her quite a distinctive look. In 2018, at the age of 19, when I look at Sabrina's profile view, what I'm seeing here is that she has a more rounded type of forehead, and that can sometimes give the illusion of a larger forehead. But it's not that she has a large forehead. It's not that her upper third is much larger than the middle third or the lower third, but what gives it that illusion is how much roundedness there is to the forehead itself. And that might be one reason why she seems to use her hair to hide partially some of her forehead. Now, it might have nothing to do with that, or the roundedness might have something to do with her actual hairstyles. Keep in mind that the size of the forehead is not just its height centrally, but also the width of it laterally. So how far out it goes to the sides will also dictate if it looks like a larger forehead or not. Some people have quite a short forehead centrally, but as you go out laterally, there's quite a bit of width, let's say from the tail of the brow to the actual temporal hairline. And so sometimes when I'm doing hairline work and looking to help frame the face, it's not just bringing down the central hairline, but it's also bringing in the lateral hairline, because that can also shrink down the overall appearance of the forehead for people who are bothered by that. Also on profile view, what I'm seeing here is a small dorsal hump. So as you come down from the radix of the nose down towards the tip, you can see that there's this slight convexity to the nasal bridge, and that's that small little hump. In 2019, at the age of 20, Sabrina seems to be using makeup to highlight certain aspects of her face. For example, when you look at her cheekbones, there's a bit more definition there, and I think part of that is because of the shadowing that's placed underneath the actual cheekbone, and that gives the cheekbone a bit more of a pop. Also, I do think that she's starting to overline her upper lip, and that's starting to create more of a one-to-one upper to lower lip ratio. But I also see some signs here of the potential introduction of lip filler, both to the upper lip and to the lower lip, to add some hydration and a bit more volume. As we know with lip filler, it's important not to overdo it. You don't want the lip to start to stick out anteriorly to project forward, because that's what gives that ducky appearance. So avoiding the actual vermilion border when you inject is very important in trying to prevent that type of appearance. And I think that they've done a very nice job in Sabrina's case of not overfilling the actual vermilion border. In 2020, at the age of 21, I see no change. In 2021, at the age of 22, what really stands out to me here is how thick Sabrina's eyebrows are. It's quite in vogue again to have thicker eyebrows, and there are different ways in which people can achieve that look. Now, for some people, it comes down to just using more makeup. Other people might try some tattooing or some more permanent type of makeup, or even microblading. Yet others will sometimes go for eyebrow hair extensions that get glued on. And there's another method called an eyebrow hair transplant, which isn't as common, but it's something that I do in my practice, and we have dedicated videos on that subject, and that can really help enhance, especially after someone's done a lot of plucking or their eyebrows are just naturally thin. But I think in Sabrina's case, her eyebrows are naturally quite full, and she's sporting them, which I think they look great. Also, what I think we're seeing here is potentially the introduction of cheek filler. When I compare back to this image of her in 2017, what I'm seeing is that now there appears to be more laterally based volume in her cheeks, as opposed to her more original organic state, which is more medially based volume. So now there's this extension out laterally, which starts to bring more of that width to her upper face as opposed to just the lower face. Some people will actually get cheek implants to achieve a similar appearance, but I think in her case it was probably cheek filler that was added to the zygoma region of her cheek to fill out that lateral component. And before I continue, I just wanted to thank everyone who's tried our Feel Confident skincare and hair care products. We made them from scratch with love. We put amazing ingredients in them, and we tried to keep them affordable. So thank you guys for showing your support, and for some of you for even becoming brand ambassadors, which is really cool. And for anyone who hasn't tried the products yet, make sure to head to feelconfident.com to try them for yourself. In 2022, at the age of 23, I see no change. In 2023, at the age of 24, I'm seeing some signs of a potential tip rhinoplasty. So to me, Sabrina's bridge looks untouched. It has the same width as it did when she was in her teenage years, but now the tip appears to be more narrow. It's similar to the width of her bridge, whereas before the tip was wider. And these results are less obvious than when the hump is also taken down. So many celebrities will actually leave some convexity to their nasal bridge with that hump, and instead just get their tip more refined. That's harder to spot than when the whole nose is redone. And when we compare back to Sabrina at age 16, we really start to see that difference to the nasal tip, whereas the nasal bridge looks quite similar. And in 2024, at the age of 25, when I look at Sabrina's lips, to me, the upper lip looks more arched. And I think that's probably from the continued use of filler. I don't think she's had a lip lift. So with the overlining and the additional filler, that's given her upper lip quite a nice upper arch. And that's something that is sometimes difficult to achieve naturally with filler, but I think her lips still look great. So this was likely done with small, tasteful amounts of filler over years to create this appearance. This is not something that you just go in, get 1 syringe of filler or 2 syringes of filler at one time and call it a day. This is something that's done gradually with a very calculated approach, and I think that she still looks youthful and natural and does not look like she has overdone lips. And the total cost of these potential cosmetic procedures is $40,000. Let's take a look at Angelina Jolie and see how she's managed to maintain her exquisite looks over the years. We will discuss the cost of some of these potential procedures at the end. In 1991, at the age of 16, what I'm seeing is that Angelina has a rounded hairline. She has beautiful brow aesthetics. The medial and the lateral elements of her brow are at the same horizontal height. She has a boxy nasal tip and very full lips, which we of course know her for. She has a broad jawline and a characteristic mole on the right forehead above her eyebrow. In 1992, at the age of 17, you can notice here that her lower lip is about twice as full as the upper lip, and this proportion will later change, so keep track of that. In 1993, at the age of 18, she has this pillowy appearance of just natural youthfulness, with plenty of natural fat throughout her face. That, of course, changes as we get older. In 1994, at the age of 19, Angelina has this very nice wide smile with full exposure of her upper teeth. In 1996, at the age of 21, you can see that she has this thinner eyebrow appearance, and this is likely due to some plucking. She has great supratarsal show right above her upper eyelid margin. She has significant upper tooth show on repose. Both the central and the lateral incisors are visible when she just opens up her mouth. She has a very nice short philtrum, well defined, and the Cupid's bow is also well defined. She has strong cheekbone structure, and the chin is, of course, prominent and strong as well. In 1997, at the age of 22, you can see a return of some of her eyebrow fullness, both in the head and the body of the brow. She has upper lip fullness that is more significant than what she's had prior. And she has actually admitted to getting lip silicone injections in the past. So perhaps this is around the time when she's had that done. In 1998, I'm not seeing any changes. 1999, what you can see is when you look at her nose, both in this photo here on the right compared to how she looked at 17, I'm not seeing any obvious signs of a rhinoplasty. Others have commented on this and have thought that, early on she had a rhinoplasty, but you can see that depending on lighting and the way the makeup is done, it can be quite deceptive, especially for analyzing the nose. But at least at this stage, I'm not seeing any signs of a rhinoplasty. In the year 2000, at the age of 25, what I'm seeing is that Angelina has a nose tip that starts to look a little bit more narrow, a bit more defined. So I don't think she's had the rhinoplasty when she was younger. Maybe around this time, around age 24, 25 is when she had her rhinoplasty to improve to some degree some definition to the nasal tip, but it really wasn't a major change. It wasn't a big overhaul. It was just a subtle improvement to the nasal tip, if anything at all. In 2001, at the age of 26, you can see that Angelina has some under eye hollowing on the left that's more pronounced than on the right. And this is the same type of discrepancy as when she was 16. We all have facial asymmetries, and sometimes one side under the eye can be a bit more hollowed out than the other side. I'm not seeing any actual other procedures really being clear to me here. In 2002, at the age of 27, no further changes. You can see here that her right eyebrow sits higher than her left. And when she has the dark makeup on there, it makes it even more obvious. In 2003, at the age of 28, the left lateral brow is starting to descend to a degree compared to her photos from prior. And the reason this is happening is because you have the temporal line, and lateral to the temporal line, which is a fairly thick structure, the brow isn't well supported. And so the lateral brow tends to descend as we age, much more than anything more medial to the temporal line. In 2004, no signs of changes, same in 2005. In 2006, at the age of 31, is around the time of the birth of her first child. The photo here is a great example of how photography can really distort, especially photography that has been further edited. It can distort your normal anatomy. And so you can see how the nose in this image appears much more narrow, but this really doesn't hold up in future images. So with the ability of makeup to contour the nose, the way the photographs are taken and also sometimes re-edited can really alter one's appearance. In 2007, at the age of 32, there are no further changes. 2008, she is pregnant at this time, no further changes seen. 2009, you can see that she has rhytids, which are wrinkles, visible on her forehead and starting to be visible in the under eye area. There are no obvious signs of Botox that I can see at this stage. 2010, age 35, no further changes, same in 2011. In 2012, she's sporting fuller eyebrows, which I think really looks great on her. And you can see that there has been a reduction of lateral cheek bone volume. It's just something that happens. Over the age of 25, the overall bone density goes down in men and women. And so, that's just what's happening to Angelina. She's not immune to that. And so the lateral bone volume goes down and the facial appearance is going to change. And it's always tempting to think that, they've had more procedures and cheek implants and other things that might give you this look, but there's also an aging process that is going on. 2013, at the age of 38, I'm starting to see some signs of Botox being used to the forehead, glabella, crow's feet. You can see a smoothing out of those areas. Also notice slight changes to the hairline corners here. The frontotemporal angles are starting to basically recede a little bit. There's a bit of basically standard, typical hair loss that's occurring in that area over time, which is very minimal in her case. In 2014, at the age of 39, I'm not seeing any further changes. Same in 2015 and 2016. In 2017, at the age of 42, there are some signs of facial drooping starting to occur, sagging and ptosis of the face that's visible in her lower face, not quite jowling, but starting to see that there is that descent. In 2018, at the age of 43, no further changes. However, in 2019, age 44, I think Angelina may have had an upper blepharoplasty around this time. There's an increase in the supratarsal show and a more hollowed upper eyelid appearance that can occur with upper blepharoplasty. In 2020, at the age of 45, most of the pictures around this year were, of course, with a mask on, and it's hard to, of course, see what changes have occurred, but it's also a great opportunity to have had facial plastic surgery. So we'll see in the next 2 years if maybe there's some signs of some work that was done around this year. In 2021, at the age of 46, I'm seeing some signs of cheek filler being introduced. You can see medially and laterally there's quite a bit of fullness that has been added to that area. And I think most likely that has to do with filler, most likely hyaluronic acid-based filler that was introduced. In 2022, at the age of 47, I am seeing signs of a facelift. And this may have been a deep plane, it may have been a SMAS type facelift, not sure. But when you compare her left tragal contour back to the image from 1998, you can see that it has completely changed in its quality. Right in front of the tragus, there naturally is a little bit of a drop off. And what I'm seeing in this image, looking at her left tragus in 2022, that drop off has been lost, and really it looks like the skin has been draped over that area. And overall, obviously, there was great work that was done. I mean, she looks rejuvenated. She doesn't look stretched out. Really nice healing has occurred, but it does to me look like a sign of a facelift. The other element that I can see here is that she has loss of her sideburn hairs. So you can see in this, again, image in 1998, there are those fine little hairs, villus type hairs on the sideburn area that are coming down from the temple. And in 2022, those little hairs have mostly been lost. I don't think that occurred naturally. I think most likely they were removed as part of the facelift procedure, which is fairly standard for facelift surgery. The total cost of these possible procedures that Angelina may have had is $180,000. Hey guys, Dr. Gary Linkov here. So let's discuss Madonna and see what facial procedures she may have had over time. So in 1982, she was 24 years old, and I'm looking at this photo and I just love the hair. I mean, it's absolutely amazing. Keep an eye on the height of the hairline, by the way. More on that later. She just has these like beautiful full eyebrows, and look at like those eyes, they're just like piercing at you. Really just so nice. She's got this great nose. I think it matches her face perfectly. She has very nice cheek volume in this image, and it just looks very natural, right? This is what natural looks like. This is someone who hasn't had fillers placed and hasn't kind of had any major surgeries or anything really at this point. So the lips, for example, also just look natural. You have that nice pillowy look. The bottom lip is bigger than the top lip, which is actually a very classic normal aesthetic. Look how sharp her Cupid's bow definition is, just looks really good. She has a nice strong mandible, clean jawline, and the neck looks perfect. That is her at 24, that's Madonna. 1983, note how youthful the eyelid area is, the upper eyelids. See how full the infrabrow area is under the eyebrow. That is a hallmark of youthfulness, and that's something that as we age, it becomes more and more hollow, and we lose that fat pad in that area. So she has no hollowness there. She has a nice clean transition between her lower eyelid into the cheek, and you don't see any kind of tear trough that we all get over time because she's only 25 years old in this image. 1984, not seeing any major changes compared to prior. 1985, about the same. Things are still looking very youthful. I don't see any signs of any major procedures being done. 1986, age 28, and you're starting to see here the early signs of mid-face aging, and that basically is caused by two primary factors. One is that over time there's a descent from gravity of the tissues, they start to fall, and number two is that there's some atrophy going on, there's some loss of volume. So you're starting to see like this increase in the nasolabial folds, right? They're just becoming a little bit more visible, and that's because the lateral cheek is starting to fold inwards. 1987, again, the eyebrows are back and they're better than ever. So look at that fullness there, and you are again seeing the mid-face starting to kind of slowly fold inwards, in and down. That's what happens as we age. And so when we do any kind of surgical procedure, for example, we're trying to reposition it up and lateral as opposed to in and down. 1988, age 30, she's looking great. I'm not really seeing any major changes from prior. 1989, same thing. 1990, this is where it starts to change. Take a close look here. She's 32 years old. The hairline, to me, looks higher. Compare it back. Look at the difference compared to how it is now. It's higher. Now, maybe it naturally progressed backwards, and that's possible, though unlikely. It's much more likely, in my opinion, that at this point, or maybe the year before, or sometime within that last year, from 89 to 90, she had had a brow lift. I think. At that time, endoscopic brow lifts weren't really a thing, even though endoscopic brow lifts can also raise up your hairline. Probably she had some sort of a coronal approach behind the hairline, big incision to kind of lift things up. As you do that, as you lift these brows, the hairline comes up, so that's like a telltale sign. So I think it's elevated her brows and it's kind of fixed the eyebrows in position, but it's also raised her hairline. So that's what I'm noticing there. 1991, again, note the higher hairline relative to her her earlier photos. 1992, this image is a little bit difficult to interpret, but it doesn't look like a whole lot has changed. 1993, age 35, not too much has changed from prior. 1994, it looks to me like she may have more of a fill-in in the mid-face, in this section out here, and there's less of this medial bunching. So how is that possible? How did that happen in 1994? Here's a clue on this next image in 1995. At age 37, take a look at the left tragus. So that's this part of the ear right here, the front part of the ear. It doesn't look normal. It looks like it's expanded in the vertical dimension, and it's lost a lot of its character. It just looks out of place compared to the rest of the ear. And to me, that's a sign that she probably had a facelift, right? So you can see that change of the tragus. It's bigger, the shape has changed. This is a sign of a facelift. So I think that can explain the anatomical changes that we're seeing on that last slide that I just showed you, and because it looks to me like she may have had her first facelift around this time. We'll talk about this briefly, when people should get a facelift for the first time. The issue with starting young, like in your mid-30s, is that you're just going to need more of them over time, because we know that facelifts, they generally don't last more than 10 years. You pretty much just are then subjected to probably needing more to keep up with the aging process. So that's one of the issues with starting early. You know, I understand that there are definitely signs of aging that happen in their late 20s, early 30s, and people are seeing that and they get frustrated and they want a fix. Sometimes they want something more than just injectables. You know, it's one of the downsides of starting early, because as you'll see, she had additional procedures, additional facelifts. Now, 1996, I don't see a whole lot that's changed. 97, also not much has changed. 1998, age 40. Notice the lengthening of her face compared to age 25, and she went from a sort of rounder face to like a longer face, and even the philtrum under the nose has started to lengthen as well, and we know that that's something that happens, and that's why people come to me for lip lifts. The mid-face lateral cheek volume is declining, and it's starting to droop again. In 1999, what I'm noticing, especially in this image here, is that to me it looks like she has some ptosis of her left upper eyelid. And ptosis is something that happens sometimes from birth, and sometimes just from wear and tear on the body, and other times just from surgery in that area. But it's the actual muscle that helps lift the eyelid that gets impacted. When that happens, it's not enough to just do a blepharoplasty, which is just oftentimes removing skin. You have to go in and fix that muscle, fix those ligaments that have caused that descent of the eyelid. And so as you'll see later, the ptosis actually gets repaired with a subsequent surgery. So you can see how the left eye, the eyelid is down a bit, and her eye is looking a bit more closed on that left side compared to the right. So it's just an observation. The year 2000, she was 42 years old, and she just looks more volumized to me. This suggests that maybe she had fat transfer performed. Maybe there was some filler placed. But in the year 2000, the only FDA-approved filler product was actually collagen, and the first HA filler, hyaluronic acid filler, was actually approved in 2003. It was Restylane for the nasolabial folds. In 2001, age 43, take a look at the upper eyelid hollowing, and that goes back to what I was saying previously, where when she was younger, that was filled in and it looked more youthful. As we get older, there's that hollowing that occurs. And part of the reason why you get that hollowing isn't just because you lose some fat in that area. It's also because the bone is starting to resorb. Our bone health is the greatest at around age 25. And then as we get older, it starts to decline. And so the eye socket changes as well. So the underlying skeleton of our faces is changing with time as well. The lateral canthus, which is this portion of the eyelid all the way on the side here, and the lower eyelid, to me, starts to look like it's loosening and it's starting to descend down. You'll see in later images that gets corrected and gets tightened up. So notice the change in the cant of the eye. It goes from kind of swooping up to being a lot more leveled, as you can see in this image. And she has continued mid-face descent. And I'm starting to see some early jowling as well. 2002, not much has changed. 2003, age 45, I think at this point she's continuing to get neuromodulator, such as Botox. I think the volume overall is partially restored again, so maybe she's had more filler. I think she's continuing to do the non-surgical stuff throughout these years. Some of those years are punctuated by actual surgeries, but the rest of the time she's doing non-surgical treatments on her skin, neuromodulators, fillers, that sort of thing. 2004, age 46, not much change. 2005, age 47. So now it's been about 10 years since her last facelift. Like we talked about earlier, 10 years is about the upper limit of how long a good facelift will last. So it appears to me like she's gotten another facelift at this time, 2005. 2006, age 48, you can really see that the mid-face shift is there and the jawline has been tightened from that second facelift, and I think she's looking really nice. It's likely that she's also had that coupled with upper and lower blepharoplasty or eyelid surgery, and maybe by this time most likely a revision brow lift as well. 2007, not too much has changed. 2008, she's now 50 years old. I think her brows are at a great height and she has nice shape preservation to the brows. They're not over plucked at this point. She has nice cheek volume and has that heart shape preserved face, and that's really nice. 2009, take a look at the upper lip. To me, it looks like the Cupid's bow area has lost some definition, which occurs with time. There's a flattening to the Cupid's bow. And also in the neck, you're starting to see some neck banding. And it's unclear if she's had a platysmoplasty to go along with her facelifts, and that's what allows for that medial tightening of the platysma muscle to reduce that banding. It can also sometimes be addressed non-surgically with Botox, but it's not as effective. 2010, this is where she has this like puffy look starting to develop. I think that she's starting to just look overfilled here. Throughout the cheeks, throughout the lips, everything just looks really filled in to the point of not looking as natural anymore, in my opinion. 2011, age 53. Take a look at that left eye. Notice how that ptosis, that upper eyelid slight droop, has been addressed. It now looks a lot more open, which is interesting. 2012, not too much change. 2013, continued use of neuromodulation and maintenance filler. 2014, to me, she's starting to show some sequelae of having had facelifts in the past. And so you can see this line forming. It's going from the oral commissure, which is the side of the mouth here, all the way under the cheeks, all the way back. And that has been described by some as the Joker line. And it is basically because as you pull on the smaz layer, and we have a whole facelift talk that we're going to be putting up soon, but as you pull on that smaz layer for a facelift, and if you don't release that layer from the mimetic musculature, which are the muscles that actually move the face, you can sometimes create a pulling on those muscles, and that pulling can be obvious in pictures such as these. So that happens, and it's also a matter of how the face is redraped later on as well during the facelift. So 2015, age 57, not much change. 2016, I think she's had a significant filler boost to the mid face and to the lower face. Maybe she's had some implants placed, it's unclear, but definitely a whole lot of filler. 2017, age 59, pretty much looks similar. 2018, similar. 2019, age 61. Take a look at her brows and note how the hair of the brow has really declined over time. It looks like it's been replaced by makeup and microblading over the years. And that heavy volumization of the mid-face and the lower face continues. And it's starting to look a little unnatural. She's looking full, but it's almost too full. And she has this deepening of the nasolabial folds that's occurring. So 2020, this is where you see another major change. Age 62. It looks like she's had another facelift. Right, facelift number 3, and likely another brow lift and the blepharoplasty on top of the significant baseline filler. She's had probably so many different types of filler placed over the years that it wasn't so easy to just dissolve it, most likely prior to the facelift. So you have all this fullness and then you do a lift on top of that and you really kind of create this look. The cheek hollowing that you see here might be from a buccal fat removal that was done along with the facelift. And this is where some people would describe this look as kind of more alien-like because of that really large upper face, that overfilled upper face, and then the more narrow lower face. She doesn't look 62 here. I mean, she looks more youthful than that, but there's certain elements that look a bit less natural. Age 63, 2021. The face has been lifted, like we talked about. There are some signs of aging, though, in the neck, and the neck never lies. And so that is something else to be careful of. When a facelift is being done, it's very important to thoroughly address the neck, or else, you know, the neck starts to show your age and the face looks different, and there's this mismatch. So let's summarize what Madonna has had, in my opinion. Again, I don't really know. I'm not her treating doctor, obviously. So in summary, I think facelifts, neck lifts, she's had 3. Brow lifts, 3. Upper and lower blepharoplasty, at least 2 each. Left ptosis repair, buccal fat removal, many syringes of filler, possibly fat transfer, possibly some cheek or jaw implants. So let's summarize the cost of what maybe that could have all been. The facelift neck lifts take a range of $10,000 to $50,000 per surgery. Brow lifts, I took a range of $5,000 to $30,000, and I basically placed her somewhere in the middle of that. She probably paid on the higher end, but let's just give a range first. Upper and lower blepharoplasty, about $10,000 to $30,000. Left ptosis repair, maybe her insurance covered that. Usually that's something insurance could cover, or they were just maybe threw it in there as a little gift with the other cosmetic work. Buccal fat removal, $3,000 to $10,000. Fillers, anywhere from $500 to $1,500 per syringe. And I think she's had over the years probably at least 30 syringes, probably much more than that. And I didn't include here any fat transfer implant prices, just because I'm not sure if that was done. So if you take like the middle of the road prices for each of those types of surgeries, multiplied by how many of each type of surgery she's had, my calculation is that the estimated total for all of Madonna's surgeries and some non-surgical procedures were somewhere on the order of $215,000. Now remember, this is probably a gross underestimate, because she's had skin resurfacing, she's had a lot of other just like regular maintenance types of procedures. So if you're looking at, you know, total amounts spent on surgical and non-surgical work to keep her face looking fresh, it's probably double of what I just said. So that's just a guess, but you know, one that I think is not too far from the truth. So maybe even up to, you know, $500,000. But if you look at her needing her looks for her career and trying to maintain that, and being as relevant as she is, you know, throughout, you know, over decades of time, I mean, that's impressive, and that requires some upkeep. And some people might say, well, maybe certain things were overdone. Sure, but, you know, still, she has put in a lot of time, a lot of work, a lot of money to trying to keep herself looking as young and youthful as she could. That was her prerogative, and many celebrities go through a similar course over time. Did Amber Heard have facial plastic surgery? We'll take a look at Amber Heard throughout the years and see which facial plastic surgeries she may have had. We'll reveal costs of everything at the end, so stay tuned. In 2005, at the age of 19, you can see that Amber Heard has a very natural looking hairline. You can see that it's not perfectly round, it has some recession into the temporal area, and it has some irregularity at the hairline, and that's very normal and natural. Then take a look at her brow position. The lateral aspect of her brow, the tail, sits higher than the medial aspect, or the head of the brow, and that also is a very youthful feature. You can notice here her infrabrow fullness, which is the area just under the eyebrow itself, how it's nice and full and has that youthful type of appearance. Her nose is not prominent, which allows for the focus to be taken away from the nose and for the eyes to pay more attention to her eyes, as well as her lips and teeth and other facial features. She has a very youthful heart-shaped face, and she has a great chin and jawline structure. At the age of 20 in 2006, you can appreciate that Amber Heard has a relatively short philtrum, and you can notice that her red lip ratio, the upper to lower lip ratio, is 1 to 2 approximately. She has good upper tooth show with smiling. In 2007, at the age of 21, I don't see any major change, mostly just different makeup. In 2008, at the age of 22, I'm starting to see some signs of a brow lift. When you compare the lateral infrabrow space and take a look here on the right side compared to the prior image, you can see that there's more of an opening in that area, that the space there has been increased as far as its height, and that to me indicates that there may be a brow lift here at play. I'm also starting to see signs of lip filler being used to enhance especially the upper lip for Amber Heard. In 2009, at the age of 23, there are no major changes. In 2010, you can see just the great cheekbone structure that she has, and that becomes relevant a little bit later on. You can see the smooth lower eyelid to cheek transition that also changes as we age, but in this image, don't see any major changes occurring. Same in 2011 at the age of 25. At the age of 26 in 2012, I'm seeing some signs of an alarplasty, and this is also called nasal base narrowing, and basically taking in the wings or the ala of the nose to reduce that down. This can be done in two general ways. One is to do a sill reduction, which is the nasal sill getting shortened, and the other one is to do a wedge excision of the lateral ala here. So she may have had a combination of those two to narrow the base of her nose. In 2013, at the age of 27, I'm not seeing any major change. In 2014, age 28, I'm also not seeing any major changes occurring. Same in 2015 at the age of 29. In 2016, age 30, I wanted to point out here that Amber Heard is starting to show signs of aging. You can notice that her cheek complex is starting to descend down. It's starting to fall and go more medial or towards the center of the face. That's what happens to all of us as we age. Also, the tear trough area under the lower eyelid there is becoming more prominent as the cheek complex sags. As we age, there are two general processes that are occurring. One is that there is loss of volume in the face. So there is a gradual atrophy process that's occurring. And it's occurring not just at the skin level, but also the fat, the muscle, and the bone is starting to fall apart to some degree. So that's one. And the other element of aging is that there's descent. There's basically a drop or falling with the gravitational forces that are applied to our bodies at all times. It's causing everything to sag and fall. So those are the two main processes at play with normal aging. In 2017, at the age of 31, you can see here that to my eye, she has more enhanced cheek contouring. And I think that she may have had actually a cheek implant at around this time. Now, some people think that she had a cheek implant a little bit later, like in 2018, but I'm already seeing some signs of a cheek of a malar implant sitting there laterally. It looks different to me than her natural original cheekbone structure. In 2018, at the age of 32, you're seeing here now there's definitely something there in place on the lateral cheek, and it has some extension to the medial cheek, so to me that indicates a cheek implant most likely. Either this was the initial placement or maybe a replacement, an enlarged cheek implant compared to the year prior, who knows. And also I can see that Amber likely has had neurotoxin starting probably in a few years prior to this, and she's continued to use neurotoxin, which is also called Botox, to reduce the wrinkles on the forehead, glabella, crow's feet, those general areas. In 2019, at the age of 33, there are no major changes here. And in 2020, at the age of 34, you can see further signs of aging. So in Amber's case, you can see that the lateral, again, brow, the tail of the brow is starting to fall or descend. The lateral canthus of the eye is also starting to descend down. She has more prominent marionette lines and nasolabial fold lines that are starting to be more obvious as, again, that cheek complex starts to come down and move towards the center. Those lines become accentuated. When you look at her upper to lower red lip ratio, it's now closer to a 1-to-1 ratio. She has increased arching of the upper lip. This to me suggests either a lip lift or a V to Y upper lip advancement. Now, given the lack of visible subnasal scar and the fact that her philtrum really hasn't changed a whole lot as far as its length from her original upper lip area, to me that favors a V to Y advancement. As far as beauty lip standards, there's definitely been a shift over time from the lower lip being the fuller, more robust part of the lip to now having the upper lip and the lower lip become more at a 1-to-1 ratio with one another. And there are some people who even prefer the upper lip being bigger to the lower lip. That is not classic beauty standards, but that is something that we are moving towards in our society today. In 2021, I'm not seeing any signs of major change, and in 2022, at the age of 36, no major changes have occurred to my eye. On the high end, the total of all these procedures is $135,000, and here's the breakdown. Let's take a look at Anne Hathaway and figure out if she's had any potential facial plastic surgeries. Stay tuned for the side-by-side comparison over the years. Now let's go to the analysis board. 2006, at the age of 24, Anne has, as you can see, gorgeous hair. She has a short forehead right here. And when you look at the overall pattern of her eyebrows, you can see this fishbone type of very classic pattern to the eyebrows, the way that the hairs are arranged. So you have here the medial ones go straight up and down, and then as you start to come off laterally, you have this type of design forming. This is like a fishbone. And as you get lateral, they tend to fall laterally. And they stay very acute to the surface of the skin or of the face. She has very nice infrabrow fullness, so that's this area right in here. And when it comes to the area under her eyes, this is not fat herniation. This is actually prominence of the orbicularis oculi muscle that gives you this prominence. I have that too in my under eye area. So this is not to be confused with fat that over time can hypertrophy out. It's not what she has. This is just the hyperactivity of the muscle. She also has nostril show that is visible here and here. You'll also see that from the profile view as well. And she has some tip bulbosity. So this is the nasal tip right in through here. And there is some bulbosity to the tip, but overall, it's a very nice nose. Anne also has a very well-defined philtrum. So these are the philtral columns here. They're not straight up and down. They're on a bit of an angle. That's the way it naturally is. Also, look at her Cupid's bow. It's just like perfectly defined right in through there, as well as onto the sides. Very nice. And she has this slight gap between her upper and lower lips. So this area in through here. She has a slight deficit of the upper red lip volume, and that creates that slight little gap. But overall, the volume of her lips is really what she's known for. They're great. And she has this nice, big, broad smile. In 2007, at the age of 25, notice here the natural eyebrow shape, as well as the lateral canthus angle. So right here compared to right there. The lateral canthus will always sit a bit higher because of the flow of tears that go from lateral. Lacrimal gland, don't forget, is around here. So the tears will flow from lateral to medial. So naturally, we have the lateral canthus slightly more elevated than the medial canthus. When people get the cat eye type of lift, they get this less natural appearance where now the shape of the eyebrow is more like this, and the canthus is tilted much more, and that becomes less natural, right? So Anne looks very natural. And notice again that gap here that we were talking about earlier, and that's because of this slight deficit of the red lip here that gives her a slight gap when the lips come together. And Anne has this really nice strong chin. You can see the chin definition all through here. And what that does is it really creates a nice acute cervical mental angle. And it does help to a degree delay the aging process onto the neck as far as the aging of the neck and laxity of the neck skin. And it also helps balance out her nose. Like we said earlier, she does have some tip bulbosity, but because of the prominence of her chin, they actually balance each other out quite nicely. In 2008, at the age of 26, notice how Anne has these little fine baby hairs right in through here at the hairline, and then right in through here. So as we do hair transplants, we always try to recreate the fineness of the hairline by only using single hair grafts. But oftentimes it's very difficult to get as fine as the natural hairs that live in that area. But we try. Also, notice how natural her supratarsal area is. This supratarsal show right in through here has this very nice platform, and the amount of show that you're seeing is just right. When the upper lid skin gets too redundant and starts to hang over the supratarsal area, that's when you start to get a reduction of that show, and that sometimes leads to someone looking more tired or older. Also, when too much of this skin is removed with a blepharoplasty, for example, then you get too much show, and that can look also in a way like to be aging somebody and looks less natural. Anne also has this nice cheek fullness that looks very natural. It does not look like there's been a filler added in or that there's been a cheek implant or anything like that. Notice the nice soft natural contours. It doesn't look like someone stuck a piece of silicone in there or that she's been injected with filler in that area. In 2008, Anne Hathaway actually commented on plastic surgery. She said this: "When I was growing up, I wanted a nose job because I didn't think my nose was good. And my nose is now, I think, what lets me change my face a lot," she said. "Your face needs to have character if you're going to be an actor, or you're just kind of a face. You're not really a person or a personality." So it seems that Anne considered a rhinoplasty at some point, but then decided against it because she felt that the nose helped define her and that it was a nice addition to her face, and I would agree with that. In 2009, at the age of 27, I see no signs of any procedural changes of her face. And that's the same through 2012. In 2013, at the age of 31, now Anne is in her 30s, and you can see increased crow's feet rhytids or wrinkles, and she still looks amazing. In 2014, at the age of 32, again I see no signs of change, and this is the same through 2017. In 2018, at the age of 36, Anne has more lateral upper lid hooding, and the eyebrows are showing early signs of descent. And this is just what happens as we get older, as we get into our mid and late 30s. That is very common. In 2019, at the age of 37, I see no change, and same in 2020. In 2021, at the age of 39, it seems like Anne has started to receive Botox for the forehead, glabella, and crow's feet. Let's go to the analysis board. Okay, so this is Anne at the age of 39 in 2021, and this is Anne in 2020 at the age of 38. And you can see in 2020 she had these rhytids, these wrinkles that were forming on the forehead. And when you look in 2021, you can see them here also. Wrinkles here, wrinkles here. When you look in 2021, it looks much smoother. I think it was around this time that she started to maybe get some Botox. And the Botox was performed into the frontalis muscle, which is the forehead. The frontalis muscle lives here, right in through here, and it extends back some. And so when you do the injections for the forehead with Botox, I usually like to leave a clearance zone for at least 1 centimeter above the eyebrows so that you don't drop the brows. So usually a little clearance zone. And so this is the area that you go in and you can inject some Botox throughout to smooth out those lines. The other common area to inject Botox into is basically the glabella area. So you can see she's got these little lines forming here, and then they're gone. For this area here, it's typically the corrugator muscles that live in this area and the procerus muscle that lives right here that you're targeting. So Botox can be injected here, 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 and sometimes centrally to reduce those different frown lines. And then lastly, for the crow's feet, look at this area right here. That's because of the activity of the orbicularis oculi muscle, similar to the muscle responsible for this area, just a different component of that muscle. You get these lines, so you can use Botox to soften that, and you can see the softening effect right in through here. You usually don't want to put Botox into this area because that can lead to some functional problems with the way that the eye actually works. In 2023, at the age of 41, I wanted to highlight here how spectacular Anne Hathaway's skin looks. She likely uses some combination of, say, retinol, which helps speed up cell turnover, and sunscreen. UV rays tend to cause DNA damage in the skin, and that can lead to premature aging and potentially skin cancer. So it's very important to use sunscreen. And she also likely gets a combination of regular facials, potentially some laser procedures to keep that skin as optimal as it can be, and maybe even some chemical peels. Now let's go to the analysis board. Here's Anne in 2023 at age 41, and here's Anne at age 24. And when you look at the vermilion border right here, this area right in through here, what you can see that's different compared to the age 24 picture is what's called the white roll. And it's this little prominence that exists right at the border between the red portion of the lip and the cutaneous portion of the lip. Right in through here, there's this little prominence. And it adds like this youthful softness to the lip that some people try to recreate with filler, but you can't really recreate it because it's not so much that it sticks out, but it's rather this little mound, and we tend to lose that over time. Now, the other point that I'd like to make is you can see the tightness of the face is also different. In the lower face, there's definitely some degree of droop of the skin of the lower face, right? Compare this jawline and how sort of tight that jawline looks and how pulled that skin looks. Compared to now 41, there is definitely some degree of drop that's occurring. And so some people will decide, hey, this is too much of a drop and I want a facelift. But I think Anne looks great at age 41 without any facelift. Something that is debated online is, has Anne had a rhinoplasty? And I even sent some of her photos to some esteemed colleagues of mine. And the overall assessment is that there's no signs of any obvious rhinoplasty. I think Anne's changes of appearance and her ability to conform to different roles and styling, I think that speaks more to what makeup can do with the ability to contour the nose, to make it look straighter, to make it look thinner. And so she has really mastered that ability. So she can take her natural baseline nose and really tweak it in different ways with the use of makeup to give it slightly different appearances. This video is about Renee Zellweger and the facial plastic surgeries that she may have had. In 1996, at the age of 27, you can see here, this is her natural appearance, and she has great proportion of the horizontal thirds of the face. She has a really nice lateral brow position, great cheekbone structure. I think her nose complements her face beautifully. You can see the natural fullness of her lips. You can see the strong jawline and chin. And one thing to notice is that there's this lack of supratarsal crease, and that's the crease right of the upper eyelid, and that's relevant to what we'll see later on. So just something to notice. She has it just congenitally not present. So that is a natural look for her and something we'll discuss more later on. So we're at the end of this video going to add up the approximate cost of her surgeries and some of the non-surgical procedures, so stay tuned for that. In 1997, at the age of 28, I'm not seeing any changes. It's interesting here, I'd like to point out that the lower tooth show here that I see in many of her photos give her this kind of very characteristic look, and there's this natural central deficit of her lower red lip that's accounting for this, and that's just something, you know, she was born with, which is something I see on some of my patients, but I think worth noting because it does give her a characteristic look. 1998, at the age of 29, there's great upper tooth show with the beautiful smile, and you know, I generally don't comment on veneers. I'm not a professional in that, but who knows, maybe she had them here, maybe not, but we'll keep going. 1999, at the age of 30, I don't see any changes. 2000, age 31, no change. There are still signs of natural forehead horizontal lines or rhytids that are visible, which says to me that there hasn't been any Botox use or anything like that at this stage. 2001, age 32, I don't see any signs of change. 2002, age 33, there are some early signs of lateral brow ptosis where the lateral aspect of the eyebrow, the tail, starts to slowly descend down. That happens to all of us as we age. So I'm seeing some of those signs here at age 33, and I'm seeing some signs of maybe the early start of Botox and filler. This is around the time when it was starting to get more popular, around the time that it became FDA approved for use for cosmetic purposes. 2003, at the age of 34, Renee's face appears fuller. I'm not sure if this was possibly just weight gain. I think oftentimes we underestimate the impact that weight change can have on the face, both on making it look thinner or fuller, and it's not always the result of some sort of surgery or injectable. Sometimes it's just changes in weight and fluctuations. 2004, at the age of 35, I'm not seeing any signs of obvious change. 2005, age 36, what I'm seeing here is that Renee Zellweger seems to have had a brow lift. And notice how that lateral brow is now more lifted. When you compare the head of the brow to the tail of the brow, there's an upward slope that you see going from the head to the tail. And that is more of what she had when she was much younger, even though she's still just 36, but I'm seeing signs of a lateral brow lift, and there's just more infrabrow space. The space below the brow and above the eyelid, there's just more there. So I think she may have had a brow lift at this point, and possibly along with that a canthoplasty to reposition the eye into a bit more, again, of a youthful position as opposed to just horizontal, lifting that lateral canthus and creating a little bit of a cant there. 2006, at the age of 37, I'm not seeing any obvious change. 2007, at the age of 38, I think there's been continued use of neurotoxin. You can tell on the forehead, on the glabella, they look very smooth, and I think that's signs of continued neurotoxin use such as Botox. 2008, age 39, no major changes. 2009, age 40. So initially, when I looked at the photo on the left here, there was a lot more definition to the bridge of the nose, and it just looked more narrow, and I started to think, well, maybe she had had a rhinoplasty, but as I kept looking on over time, I saw that the nose actually looked very similar to her original. So I think that in this specific image, either it's the use of makeup or potentially a Photoshop type of result here that makes the nose look a lot more narrow, but I do not think that Renee had a rhinoplasty at any point, actually. 2010, age 41, no major changes seen from prior, same in 2011. 2012, age 43, I see some signs of upper and possibly lower blepharoplasty. So that's upper and lower eyelid surgery. You can tell with the upper eyelid, and this goes back to what I said initially, where Renee doesn't naturally have a very obvious supratarsal crease, but now you're starting to see a supratarsal crease, and one way to do that would be to just do an upper blepharoplasty where you're removing a lot of skin and you can start to get a hollowing of that upper eyelid. You can start to see some upper supratarsal crease. Another way is to do a brow lift along with that. I think she's probably had a combination of the two, but in this specific sequence, I think it was an upper and lower blepharoplasty. Moving on to 2013 at age 44. So I think she may have had cheek implants at this point, plus minus fat transfer to the face. The face looks fuller in parts. The cheeks, even though she naturally has full cheeks, I think she was starting to lose some of that volume, and it looks restored, but in a very kind of specific type of way that may be the result of a cheek implant. Again, this is all speculative, but these are just some of my thoughts. 2014, at the age of 45, I don't see any further changes. Same in 2015 and 2016. In 2017, age 48, still no major changes compared to few years back. But in 2018, at age 49, I think that Renee Zellweger had a revision brow lift. The brows again look more lifted, and she may have had an additional revision upper blepharoplasty at this time. That would not be unusual to do that form of combination, and I see that sustained in the years to come. In 2019, at the age of 50, I think she may have had a facelift at around this time. One thing that I look for, aside from just the tightening of the jawline, is also the tragus position. So that's the position of this structure right in here in front of the ear. As you pull the skin back and go to remove the excess skin, if you remove too much, what happens is that the skin can recoil back, and as it recoils back, it can sometimes pull the tragus forward. And so what can happen is something called a shotgun deformity, where the ear canal is now more open because that tragus has been pushed forward. And I'm seeing some signs of that on her. Again, just speculative, but I think maybe she had a facelift around this time. 2020, age 51, no further change. 2021, so now this is last year at the age of 52, I think she may have had additional fat transferred to the face, maybe also some filler, maybe one, maybe the other, maybe a combination of the two. There's just, again, added fullness to the face that I think that may have contributed the fat transfer. 2022, age 53, with some of these recent photos, what I'm seeing is that she may have had a revision cheek implant. The cheeks, and this again is starting to make her look very different from what she looked like originally. I think the focus of the cheek volume is more medially based as opposed to how she had it more in youth, where it was more laterally based, and that to me signals a potential cheek implant revision. And again, if you look at the left ear on this photo on the right hand side, you can see that the tragus is just kind of pulled forward, and that to me suggests a potential facelift result from a few years prior. On the high end, the total of all these procedures is $315,000. Today we'll take a look at Nicole Kidman throughout the years and see which facial plastic surgeries she may have had done. Stay tuned until the end to find out the total price of these procedures. In 1983, at the age of 16, you can see that the eyes here are really at the centerpiece of her face. They really bring out a lot of character and definition. The nose matches her face nicely. She does have a distinctive cleft between the lower lateral cartilages, and this we will keep track of as we keep looking throughout the years, because any changes to this cleft would really be a giveaway for a surgical type of modification. She does also have a nice strong jawline. In 1986, at the age of 19, you can see that Nicole has very nice horizontal thirds to her face. She has a great eyebrow fullness. She has a striking combination of eye color and hair color. She has good lip volume with upper tooth show on repose, which means when she slightly parts her mouth. In 1989, at the age of 22, you can see that Nicole Kidman has an incredible neckline. And I think one of the main reasons for this is that she has a hyoid bone that's positioned posterior and superior, which allows for that acute cervical mental angle to be created. In 1991, at the age of 24, what I'm seeing here are very strong cheekbones. You can see how the prominence of the cheekbone is out further lateral, closer to the tail of the eyebrow on that same vertical plane. When people overuse filler, they tend to fill more medially, closer to the center of the face. But in a natural configuration, that most prominent zone of the cheek is more laterally oriented. You can also see in this picture that Nicole has an M-shaped hairline, and this is a variant of a normal female hairline. In 1993, at the age of 26, what you can see in this picture is that the lateral nasal wall is naturally medialized, and it appears to be a little bit weaker. You can tell this by the deep supraalar crease that she has running across. Now, in some patients, this happens as a result of nasal surgery, but you can see in Nicole's case, this is just her natural nose. It's possible to have normal breathing with this type of nasal configuration. In patients who've had numerous nasal surgeries, sometimes when they reach this type of lateral wall weakening, they can experience some difficulty with the nasal breathing. In this image as well, you can see a nice bony transition on the right side from the malar prominence to the inframalar hollowing and back to the gonial prominence. In 1994, at the age of 27, I'm not seeing any changes. In 1995, at the age of 28, you can see here that Nicole Kidman's upper eyelids are starting to appear heavier. She has the loss of a supratarsal crease, and this is more prominent on the right side compared to her left. Of note also, the right eyebrow is positioned higher than the left, and this is largely to compensate for this difference of eyelid position between the right and the left side. In 1996, at the age of 29, I'm not seeing any changes. Same in 1997. In 1998, at the age of 31, you can see that the supratarsal crease is evident mainly when Nicole animates with her eyebrows elevated. That brings out that supratarsal crease. The infratip cleft of the nose, as we mentioned earlier in this talk, is still preserved, and I don't see any signs of any nasal procedures. In 1999, at the age of 32, there are no further changes. Same in 2000. 2002, age 35, I'm not seeing any obvious changes. In 2003, at the age of 36, we're starting to see that Nicole seems to be getting some lip filler and some neuromodulation, such as with Botox. You can see that the forehead, the crow's feet, and the glabella are very smooth, and smoother than you'd otherwise expect for a 36-year-old. So it looks like there is the use of Botox, and her lips just have more fullness, especially of the upper lip, compared to her prior upper lip configuration, and that is most likely due to HA lip filler. In 2004, at the age of 37, what I'm starting to see is that the mouth corners are beginning to turn down a slight bit. 2005, age 38, no further change. Same in 2006 and 2007. In 2008, at the age of 41, you can see these obvious changes to her upper red lip. As she's smiling, you could see the irregularity of the upper red lip when you look from the left to the right side. There are various waves and pockets of lip filler in those locations. In 2009, at the age of 42, I'm starting to see some significant changes around the eyes. It looks to me that Nicole Kidman may have had an upper blepharoplasty with a possible ptosis repair to correct any levator muscle weakness of the upper eyelid. She may have also had a lower blepharoplasty around this time. I'm seeing signs of less hollowing under the lower eyelid. Also, it looks like Nicole Kidman may have had a brow lift around this time to go with her upper blepharoplasty and lower blepharoplasty. That is a frequent combination, and one that gives her a different look compared to the images that I see prior. In 2010, there are no further changes. Same in 2011. In 2012, at the age of 45, it looks like Nicole Kidman is starting to get more cheek filler. Her cheeks have always been prominent, but now it looks like there is even more volume in that area. From 2013 to 2020, I'm not seeing any significant changes with Nicole Kidman's facial appearance. In 2021, at the age of 54, when you compare the tragus of the ear on the right-hand side, such as in this image, compared to when she was 46, you can see the obvious differences there. It looks to me like around this time she may have had a mini facelift. The jawline looks overall improved and maintained, and I'm not seeing a major shift of the mid-face, so that to me says that it probably was more of a mini facelift that didn't encompass also a mid facelift at the same time. However, when you look at her Instagram image from May of 2022, you can see that there are obvious changes here, and to me these look like signs of a deep plane facelift. Now the mid-face has been addressed and lifted. Also, you're seeing a shift in the sideburn area compared to what came before, so that again is an indication of a additional facelift, in this case likely a deep plane facelift. Also, if you look at the tail of her eyebrow, it looks to me like it's been lifted as well. So this is a sign of a temporal brow lift that may have been done at the same time as the deep plane facelift. The total cost of all of these procedures on the high end is $420,000.
Let's take a look at SZA and see if she's had any potential facial plastic surgery procedures throughout the years. All estimated costs and a before and after are revealed later on, so stay tuned. In 2013, at the age of 24, I can see that SZA has a rounded, well-positioned hairline. She has good facial proportions with about equal horizontal thirds. She has nice full eyebrows, a youthful lateral canthal position to her eye, and she has a beautiful classic ethnic nose. Also, SZA has nice full upper and lower lips with full tooth show on smile. In 2014, at the age of 25, she has a unique birthmark or freckle pattern across her midface and lower face. Also, SZA appears to have a short philtrum. In 2015, at the age of 26, I see no additional changes. In 2016, at the age of 27, to me it looks like SZA has a reduction of these birthmarks, both in the midface and the lower cutaneous lip. And now it appears that some of them might not be real, because over time they appear and disappear in different locations. The only one to me that looks like her actual birthmark is the one on her left upper lip. She also appears to have increased facial bony definition, and this is likely tied to the weight loss that she's described in the past. Reportedly, she lost about 50 pounds around that time. In 2017, at the age of 28, it looks to me like SZA may have had a rhinoplasty and or an alaroplasty, and this was done to project the bridge more, to narrow the tip of the nose, and also to narrow the base. In ethnic rhinoplasty, in order to project the bridge, you need to augment the bridge. So you need to bring in some cartilage into the area. That can be done through the person's own cartilage, it can be done through cadaveric rib cartilage, or some sort of synthetic material like silicone. It works differently from a Caucasian nose, where you would need to break the bones in order to project the bridge more. It also looks like SZA may have had a chin implant around this time. There's just a narrowing and a projection to the chin area that I see. I considered a V-line jaw reduction surgery, but it seems like later on the effect of this kind of sharper chin gets reversed, and that would have been difficult to do had she had the jaw reduction surgery. So I'm thinking that it was likely more of a chin implant or possibly some chin filler, but more likely a chin implant that was later removed. In 2018, at the age of 29, there's a reversal of her pointier chin, so likely the chin implant was removed. Some patients want to project their chin to change the overall facial architecture, especially to the lower face, to give it a different type of shape than they were originally born with. As far as incisions for a chin implant, they would either be placed on the inside of the lower lip or underneath the chin. The most common area is underneath the chin, because as the incision is made here and the implant placed over the bone, you don't risk going through the mouth and dragging some of the bacteria from the inside of the mouth into the area where the incision is and where the implant will be. So your risk of complications with infection are lower using this incision from the outside rather than from the inside of the mouth. In 2019, at the age of 30, I see no further changes. In 2020, at the age of 31, it looks to me like SZA may have had a lateral brow lift. You can observe the impact on the supratarsal crease, especially on the right side. It looks like her brows are now positioned higher, and it looks like there's more space between the upper eyelid and the eyebrow. Also, it appears that SZA may have had a buccal fat removal, and we've covered this topic at length in many of our other videos. And you can see what the buccal fat removal did to her cheek area. It looks like the cheeks are more sunken in, as if she's like sucking her lips in, but in a more permanent way. And what this does is that it actually makes her cheekbone appear more prominent, because the area underneath it is now more hollowed. In 2021, at the age of 32, the only change that I'm seeing is that she has gained weight, and that of course has changed the architecture of the face yet again. And in 2022, at the age of 33, SZA actually admitted to getting some body plastic surgery. In Conceited, she says, "I don't like nobody. I don't feel guilty about it. I just got my body done. Ain't got no guilt about it. I just heard your opinion. I could have did without it." And what we do on this channel is to try to destigmatize people getting plastic surgery, whether that's a celebrity or anybody else. And what we find is that celebrities are often more likely to admit to some body plastic surgery than they are to any facial work. And that's been a common observation. Why do you guys think that is? Why do celebrities talk more about body work than they do about their facial work? Let us know in the comments below. The total cost of these potential procedures is $75,000. And here's a before and after.
From her life as a model to the First Lady of the United States, Melania Trump is no stranger to the spotlight and to the public scrutiny that comes with it. But has the former First Lady ever had plastic surgery, or are her model-esque features all natural? Today, we'll be exploring Melania Trump's facial transformation. Estimated costs of potential procedures are provided at the end of the video, so make sure to stick around. In 1987, at the age of 17, what we see here is that Melania Trump has full eyebrows and her eyes are more almond shaped. When we look at her nose, we can see that the tip has some natural bulbosity. And she has a balanced upper lip to lower lip ratio, and her lower lip appears fuller than her upper lip. She also has strong facial bony structure, so both her maxilla, or where the cheekbones are, and her mandible, where the chin and the rest of the jawbone is, are both quite prominent. In 1998, at the age of 28, what we see here is that Melania's upper horizontal third is longer than her mid-face and her lower face, and she also has a widow's peak at the hairline. You can see that she's sporting thinner eyebrows now, and this was the look of the 90s. I'm also seeing that her nasal tip to me looks less bulbous, and the dorsal hump, this area right at the top of the bridge, is less prominent. So I suspect that she may have had a possible rhinoplasty sometime between the age of 17 and 28. With rhinoplasty surgery, oftentimes the bridge of the nose is narrowed and the hump is removed, and the tip is made to be smaller. Both can be adjusted with a cosmetic rhinoplasty, and sometimes cosmetic rhinoplasties are done alongside a more functional rhinoplasty, where attempts are made to improve someone's nasal breathing as well. In 1999, at the age of 29, I wanted to point out here that Melania's left side of her face appears to be higher than the right side when we look at her eyebrows, the level of the orbit, the nasal ala, and the oral commissure. They're all slightly higher on the left side compared to the right. And we all have this type of facial asymmetry. It's very, very common. I also see signs of potential lip filler that have been placed into her upper and lower lips. To me, they appear fuller. And around this time in 1999, this was before HA filler was actually FDA approved. The first FDA approved filler for the face was Restylane in 2003. So what was more popular to inject around this time was collagen and microdroplet silicone. In the year 2000, at the age of 30, we see some of the signs of her past possible rhinoplasty. We see more nostril show on frontal view, which is a very common feature after a rhinoplasty. When the nose is secured and the tip is slightly elevated, usually what happens is that the nostrils become more visible, both from a frontal view as well as a profile view. And along the bridge of her nose, you can see where osteotomies were likely done. And those are the bony cuts that are made to try to narrow the bridge of the nose. Also, when you reduce the nasal hump, you can get something called open roof deformity, where you create essentially a flatness to the nasal bridge. So in order to recreate some three-dimensionality and that more pyramid type of structure to our nose, what helps is to do these osteotomies so that you bring the bones back together. In 2001, at the age of 31, I'm seeing full tooth show on Smile. In 2002, at the age of 32, what I see here is upper tooth show on Repose. So when Melania just parts her lips, we can see the upper teeth quite visibly. And her philtrum, or the distance between the base of the nose and the tip of the Cupid's bow, is now longer than it was in her teenage years. Now, this could in part be due to the aging process. As we get older, our skin expands and lengthens, and because of that, the philtrum can appear longer. But also, people who've had a rhinoplasty can sometimes see that the philtrum gets longer as well. And this is because some of the fibers of the orbicularis muscle that encircles our lips actually interdigitates or connects to the base of the nose. So anytime the base of the nose, or for example the tip, is manipulated in surgery, some of those fibers can be released, and that leads to the potential philtral elongation. And many patients come to me looking to shorten the length of their philtrum with a lip lift. In 2003, at the age of 33, I wanted to say here that Melania has beautiful skin. And some of that, of course, has to do with sun protection and just natural genetics. But Part of it, of course, has to do with skincare and how we properly moisturize our skin and care for our skin. Please make sure to check out our high-quality skincare and hair care products that are available at affordable prices. We built these up from scratch with incredible chemists and manufacturers, and we want you all to try them. In 2004, at the age of 34, what I'm noticing here is that Melania's cheeks look more full, and I wonder if perhaps she's had cheek implants, because there's so much regularity to both of the cheeks now, and there's more projection, that I think it would have been hard to get to this state with filler alone. So perhaps she had cheek implants inserted to augment her already full cheekbones. Alternatively, some people get HA filler placed into the cheeks, and some people get fat transfer performed to the cheeks to further enhance that zone. In 2005, at the age of 35, I see no change, and that's the same through 2006. In 2007, at the age of 37, Melania's eyes here start to appear smaller, and this has become a more characteristic trait of her face. Now, this can be due to a number of reasons, and I speculate on a few of them in this video, but the first possibility is that she may have had a cantoplasty or a lateral brow lift that would have brought out the sides of her eyes, and some people call this a cat eye type of look. Other people call it having the eyes be even more almond shaped, but they all have the effect of lengthening the eye and making the eyes look smaller. I think she also may have started to get some Botox to the forehead, glabella, and crow's feet around this time. In 2008, at the age of 38, we again see that the eyes appear smaller. So other than the cantoplasty brow lift theory, it's also possible that the Botox itself may have been causing the eyebrows to weigh more heavily on her eyes, creating that smaller aperture. Remember that the frontalis muscle is the only muscle that actually elevates our eyebrows. So when you heavily inject neurotoxin into that muscle, what happens is it gets more paralyzed, and as that occurs, the brows start to weigh down. And as that happens, then the eyes might start to appear smaller. And it could also be, of course, a combination of these factors that led to a smaller eye appearance. In 2009, at the age of 39, I see no change, and that's the same through 2011. In 2012, at the age of 42, I'm seeing some early signs of jowling. And that's the area right here. We're seeing some fullness developing there as the cheek complex starts to see some of the effects of gravity. It starts to move down and in, and as it does that, you start to get this jowling that forms right around some of the ligament. And as that tissue comes down, you start to lose some of the definition of the lower jaw. But as I talk about in many of my other videos, the strong bony structure to our midface and lower face is going to partially protect us against some of the effects of gravity and some of the sagging that can occur. In 2013, at the age of 43, I see no change. And in 2014, at the age of 44, I'm starting to see that there are more forehead wrinkles and the eyes are appearing more open. So maybe the dose of her Botox was lowered to combat some of those changes that were occurring around her eyes, with the eyebrows starting to feel a bit heavy. And as she's regained some of that ability to raise her eyebrows, the eyes also start to look more open. In 2015, at the age of 45, I see no change, and that's the same through 2017. In 2018, at the age of 48, we're starting to see some of that neck skin laxity building and becoming more visible. Sometimes what we see is that platysmal bands can form in the neck, and some people address that with Botox injections to try to weaken that muscle so that the bands are less prominent, and other people look to do surgery where they're basically cutting some of that muscle and then repositioning it and tightening it up. And the platysma or the neck muscles can be addressed in isolation surgically, but it can also be addressed as part of a facelift procedure. In 2019, at the age of 49, what I wanted to point out here is that the lip corners are starting to get a bit downturned in Melania's case, and this is very common as we are in our 40s and start to enter our 50s. And this is because of a combination of both volume depletion that occurs at the commissure itself, but also, of course, the gravitational drop that happens as we all age. Some people combat this with doing DAO muscle Botox injections. Other times, a deep plane facelift procedure might help with lifting that commissure from the inside. And there are also procedures like the grin lift, which look to remove a portion of skin out here by the commissure to lift that area. And the grin lift is specifically a procedure that I'm not a fan of because of the scarring that it leaves in a very visible location. In 2020, at the age of 50, I see no change, and that's the same through 2021. In 2022, at the age of 52, I am seeing that Melania's jawline looks a bit smoother, and the neck to me looks like it doesn't have as much of the redundancy or banding that I was seeing earlier. So perhaps she had a facelift, though it's not completely clear, and we're not really able to see her ears well to evaluate if perhaps the tragus has changed or maybe the earlobe itself has changed because of a facelift. We can't tell because oftentimes her hair falls over the ears. So it's possible that she may have had a facelift, but it's also possible that she may have had a non-surgical procedure, such as a skin tightening, say radiofrequency procedure, that may have given her some of that tightness back without a surgical approach. Some of those radiofrequency devices are quite nice for the early signs of aging and to tighten up some of the areas. The problem is that when you later on consider getting a facelift, the facelift becomes more challenging to perform because of all the scarring that has occurred from the radiofrequency procedure. So the tissue planes are not as well defined, and it slightly increases your risk of, say, nerve injury or even bleeding during surgery because of that past exposure to, say, radiofrequency energy or some other heat energy. In 2023, at the age of 53, I see no change, and that's the same through 2024. The total cost of Melania Trump's potential facial procedures is $203,000.
We're gonna do a facial analysis and a reveal of certain plastic surgeries that Ariana Grande may have had. At the end, I'm gonna summarize all the procedures and the approximate prices, and so you'll see that summary at the end of this talk. So 2009, so Ariana is 16 at this point, and what I want to highlight here are her sort of beautiful features of youth, right? And then we'll see how things may have changed over time. Obviously, this was before any kind of surgery. I just want to point out a few things here. So one is that if you look at her eyebrows, the tail of the brow and the head of the brow, so the lateral aspect and the medial aspect, are on the same horizontal plane. And that's a very youthful thing, and that's something that we look for when deciding whether or not to do a surgery. The lateral canthus of the eye, which is the outer corner of the eye, lives slightly higher than the medial corner of the eye. Not much higher, but slightly higher. It's another youthful feature. And actually, there's a functional aspect to it, which is that when tears are made in the eye, you want them to flow towards the nose. And so that's partly the reason for that cant of the eye that we have in youth. If you look at her nose, she has a very natural shape to it. There's a slight bulbosity to the nose tip, but it's a very soft, natural nose. There's a heart-shaped aspect to her face. The lips have very natural proportions, where the lower lip is actually larger than the upper lip, which these days that aesthetic principle has kind of been distorted a little bit, but in classic beauty and just the way that most of us are born, that is a very natural feature of the bottom lip being slightly bigger than the top lip. Again, it's different across different individuals, genders, ethnicities, but at least for her, that's a very natural look. Also look at the contour of the jawline. Just keep in mind that contour compared to what we see a little bit later. So 2010, age 17, looks about the same. Not much has changed. 2011, age 18, again, fairly unchanged, has some different kind of makeup on, whatever, but a very normal 18-year-old girl without any plastic surgery that I can see. 2012, age 19, again, doesn't look like she's had any work done. 2013, at the age of 20, I'm starting to see some changes. I think that she's had her first rhinoplasty at this point. If you look at Ariana's nose here, the bridge is narrower, the tip is less bulbous, the tip is slightly slightly raised, and there's a bit more nostril exposure, which is another giveaway for a rhinoplasty. Doesn't mean it's a bad thing, it just means that that's oftentimes what happens when you adjust the tip cartilages. You get a little bit more nostril exposure, and so that's what we're seeing here. 2014, age 21. The angle of the mandible, which is this area here, it's called the gonial angle, it appears more defined to my eye, so possibly this is the result of filler, or maybe even at this point an implant into that area. And a lot of people online will talk about a chin implant that she may have had, even though she already has a prominent chin, but just to kind of equalize the sides here, the wings of the chin. I think possibly there's been an extended implant that has also improved the gonial angle. Also, at this young age, 21, I'm seeing signs of a brow lift, most likely performed endoscopically inside the hairline. One of the giveaways here is the positioning of the eyebrow. The left one looks like it was lifted more than the right? So there's this asymmetry, the left higher than the right, and you'll see that play out for a number of years until some of the more recent photos that we have of, I think, just within the last year, where she likely got that corrected, as you'll see. Keep watching. 2015, age 22. It looks to me like Ariana may have had a canthoplasty, because the tilt of her lateral canthus is even more elevated, despite the makeup that she has, but it's even more elevated than what I was seeing prior, and that's kind of turned her eye shape into something a little bit more almond shaped that some people like. So that looks to me like it was likely done at around that time. 2016, age 23. It looks to me like the lips have been filled with some filler, likely a hyaluronic acid based filler. Now the upper to lower lip proportions are closer to a 1-to-1 ratio, and it looks like she's had some cheek filler as well. Age 24, I'm seeing a pretty stable image, not too much has changed. 2018, age 25, also about a stable type of image. 2019, age 26, Ariana, I think, has gotten even more lip filler. So now there's probably some of the filler from before, and she's added to that with an additional syringe or more of HA filler. So you're seeing that here. You know, I was wondering about that tooth show that I'm seeing, and maybe if she had had a lip lift. I looked back at some of her original photos when she was younger, and when she opened up her mouth on a pose that we call repose, actually, like this, I could also see tooth show, and the shape of her teeth, especially those central incisors, I think is pretty stable from when she was younger. So I do not think that she's had a lip lift, by the way, in case you were wondering. 2020, age 27. I think you can really see the outline because she's so thin, right? So you can really see the outline of that jawline implant. And I think it's an extended type of implant that's not just augmenting the sides of the chin, but also stretching on to this angle as well. That's what I'm seeing, at least in these pictures. It's a very, very clean jawline, but it looks to me like there's some surgical work that's been done there. Now in 2021, at the age of 28, this is just this year, I think that she's had a revision rhinoplasty. So the tip of the nose looks even more refined than it did after her first rhinoplasty. And now there's an even more obvious, what we call a supra tip break. And that's that area right over the tip of the nose. And we have a whole rhinoplasty modeling video that talks about that in more detail. Make sure to check that one out. So the supra tip break, right, then goes into the bridge. And it looks like that division has been more refined with this second rhinoplasty surgery. It looks like she likely had a revision brow lift, because now the brow height is a lot more symmetrical, and she may have combined this brow lift with a ponytail facelift. It's possible, because if you look at the nasolabial folds, they look more effaced, and you can do that with filler, but it starts to take on a unnatural type of appearance over time, especially if you're doing large quantities of nasolabial fold filler. So I think just based on the tightness of her face and the way that it looks stretched back, and again the shape shape of the eye and the brow repositioning, I think she may have had a ponytail facelift, which is a very young age to get something like that. So again, I could be wrong, but that's just an educated guess. We don't know for sure, of course. So I wanted to then kind of give you guys just like a general warning. And I know for Ariana it's different, maybe because she's, you know, this huge international pop star and has a huge, you know, following. So maybe different, and she needs it for her job, or at least she feels like she might need all this stuff for her job. I would hope that she wouldn't need it for her job, but you know, that could be some of the pressures that some of these top stars are under. But just like a warning in general about getting plastic surgery at a very young age and starting that early, especially when you're doing a lot of different aging face type of surgeries. When you start at a very early age, first of all, the expenses add up, right? Because with no surgery is perfect, so you might have, like what she had after the first brow lift, some asymmetry, right? So now you're getting another surgery to correct that symmetry. It kind of goes on and on, right? And then if at age 28 you're used to a pretty tight appearance, you might notice that 3 years later there's going to be a drop. So now you're going back in, doing more surgery. Over time, even by the time you reach like, still a fairly young age, like 50, you will have had so many plastic surgeries that, you know, can build up scar tissue and have some ramifications that aren't always so positive. So just a warning to put out there to young folks who are seeing this video or seeing just all the different plastic surgery content thrown at them and considering doing this stuff. Just have to be super careful and know what you're getting yourself into, and be careful with like doing a ton of combination procedures that really will add up over time and could have some ill effects over years that you don't even anticipate now. Back to Ariana Grande, a summary now of all the different surgeries that I think she may have had up to this point, right? She's only 28. And I'm gonna give you prices here. Rough estimates. Rhinoplasty, about $10,000 to $20,000. This is the range. Revision, rhinoplasty, $15,000 to $40,000. Jaw, cheek, lip filler with some maintenance, right? Figure $10,000 a year for over the course of about 7 years. Jaw implant, if she had that, $10,000 to $20,000. Brow lift, $10,000 to $20,000. Brow lift revision, $15,000 to $30,000. Canthoplasty, $10,000 to $15,000. Ponytail endoscopic facelift, $30,000 to $80,000. If you add that all up, at the higher end of those ranges, you're looking at about $295,000. $295,000 to look as exceptional as Ariana Grande. It's not for most people. So keep that in mind when you're seeing your celebrities, especially when they're repeatedly denying having had surgeries. Not only are some of them having surgeries, and sometimes many surgeries, they're not then revealing it, and I don't think people have a sense of how much all of this can cost, so it can get very expensive very quickly.
Demi Moore has captivated audiences for decades with her timeless beauty and unforgettable performances. But as with many stars in the limelight, rumors swirl about the secrets behind her seemingly age-defying appearance. Let's take a closer look at Demi Moore's facial evolution over the years, examining the speculation surrounding whether she has undergone plastic surgery to maintain her stunning looks. The costs of her potential procedures are revealed towards the end of the video. In 1981, at the age of 19, you can see that Demi has high, full brows. She has these big, open eyes, and she has a non-bulbous tip. I know that some of you comment that I always say that everyone has a bulbous tip. Well, in this case, Demi does not have a bulbous tip, in my opinion. Her midface and her lower face have a strong bony structure. Demi has well-defined philtral columns, and she does appear to have a thinner upper lip. In 1982, at the age of 20, I would like to point out here the natural boundaries for the eyes, the mouth, and the cheeks, and what happens when we overfill with filler. These boundaries get blurred, and you'll see that as time goes on, there are some blurred boundaries that occur with Demi's face. In 1983, at the age of 21, Demi has a slight dorsal convexity, which is a small bump on the bridge of her nose. But this does not take away from the beauty of her nose. In 1984, at the age of 22, I see no change, and that's the same through 1985. In 1986, at the age of 24, I'd like to point out the upper tooth show that Demi has on Repose. When she parts her lips, you can see quite a bit of upper tooth show, and this is generally a more youthful, sensual type of look. It appears to me that Demi may have had a brow lift around this time. The brow is now positioned above the brow ridge, and this persists for many years. In 1987, at the age of 25, when you look at Demi's central hairline, there appears to be a thinner area there, but that is where her natural part line is. And everyone at the natural part line will have a thinner appearance to their hair. Some people come to me asking for a hair transplant to thicken up an area like that. But the problem is that even though you can get it a little bit more dense with a hair transplant, it'll always appear to be the thinner portion of your hair. And that's because the hair is going in opposite directions. If you try to transplant in a different direction, then you start to lose naturality, even though you've placed more grafts into the area. So there's a limit to how much thicker you can make a natural part line appear. In 1988, at the age of 26, I see no change, and that's the same through 1989. In 1990, at the age of 28, I wanted to point out here the excellent jawline definition that Demi has. And a lot of that is attributed to the strength of her mandible, or the lower jaw. In 1991, I see no change. And in 1992, at the age of 30, there is lateral brow descent. And that is because she's now in her 30s, and that's a very common time for the tail of the brow to start to sag, even though it's very slight. In 1993, at the age of 31, Demi's face is starting to appear fuller, and this is likely because she was pregnant around this time. In 1994, at the age of 32, I see no change, and that's the same through 1998. In 1999, at the age of 37, you can see that her nasolabial folds are starting to deepen as the aging process is ongoing. In the year 2000, at the age of 38, I see no change. In 2001, at the age of 39, you can see the temporal hollowing that's starting to occur. And this is an area that can be filled, but you have to be very careful not to overfill it, because if you have the temple region starting to protrude more lateral than the lateral cheeks, things start to look very artificial. In 2002, at the age of 40, it looks to me like Demi may have started to do some Botox around this time, and this is to the usual areas, the forehead, the glabella, and the crow's feet. In terms of dosages, usually the forehead will take about 15 to 20 units. When it comes to the glabella, you're looking at about 10 to 20 units depending on the strength of the muscle. And when it comes to crow's feet, a standard dose is about 20 units combined for both sides. In 2003, at the age of 41, I see no change, and that's the same through 2005. In 2006, at the age of 44, you can see some early signs of cheek descent, and this is in part due to gravity and in part due to volume loss that occurs as we age. You can also see that Demi now has some neck skin laxity that is forming. In 2007, at the age of 45, I see no change, and that's the same through 2009. In 2010, at the age of 48, I wanted to point out that Demi has flawless looking skin, and part of that has to do with protecting your skin from sun damage and a lot of sun exposure. So using sunscreen regularly is very important. And of course, basic skincare, such as using a facial moisturizer, a facial cleanser, and like an HA serum is very good for maintaining excellent skin. We have some of those products available on the Feel Confident website, so make sure to check that out at feelconfident.com. In 2011, at the age of 49, I see no change. In 2012, at the age of 50, I'm seeing some signs of an upper blepharoplasty. This is a procedure that removes some excess upper eyelid skin, and what it tends to do in some patients is to cause some degree of hollowing of that area under the brow ridge. So you can see that occurring in Demi's case. So while the eyes might look more youthful in that they become a bit more open, that area up above, as it becomes more hollow, can actually cause a more aged type of appearance. In 2013, at the age of 51, I see no change, and that's the same through 2015. In 2016, at the age of 54, I think this is where Demi may have started to get some cheek filler. When you compare back to, say, age 21, you can see how the cheeks appear more full, especially in the medial section, closer to the center of the face. And this is where I find a lot of people over-inject. They put too much emphasis on that medial cheek. They create a heaviness here and oftentimes might under-inject the lateral cheek. So what you get is an appearance that doesn't exactly match the more youthful version of the person. And adding filler to the medial cheek can sometimes contribute to the appearance of aging, because as we get older, the volume starts to get more emphasized in the medial region as the cheeks come down and in. In 2017, at the age of 55, I see no change, and that's the same through 2018. In 2019, at the age of 57, you can see that now, with Demi getting filler into the medial cheek, especially over the course of several years, there's now this overinflated appearance. And when we compare back to a similar angle from, say, 1990, you can really tell that there has been a significant change to how her face looks now compared to when she was younger. And it's not just because of aging, it's because of the introduction of filler. Remember that filler doesn't often just dissolve on its own, as we were told when filler first came out by the different companies that make them and by many of the providers that inject them. We now know through various MRI studies that these fillers, these HA fillers in particular, tend to hang around, and they can migrate and they can move into other parts of the face as we get older. So they can be dissolved, but oftentimes they tend to build up over time and start to distort the face to a degree. In 2020, at the age of 58, I'm seeing some introduction of potential lip filler. To me, Demi's upper lip looks a bit fuller than it did in the past. And there's a lot to say about 2021 when Demi's 59 years old. First, I see some signs of a potential brow lift revision. For many years, the brow lift that she may have gotten much earlier in life, around age 24, has held up for decades, it seems. And then with the slight descent of the brows, it looks like she may have had them re-lifted. I'm also seeing some evidence of a potential facelift procedure. When I look at the sideburns, it looks to me like the hair is partially gone. You can see the level of where the hair is starting. It matches up a little closer to the lateral canthus of the eye, whereas in the past, it was definitely extending lower than that. And we know that with facelift surgery, some of that sideburn hair can be lost. And sometimes we can do a hair transplant to actually bring some of that hair back. And it can also cover up some of these scars. And we have a YouTube video on that subject. Also, I'm seeing some changes to Demi's tragal region. As we talk about in many other videos about facelift surgery, oftentimes the tragus and the skin in front of it just appears different after a facelift surgery. And some of it can be that the tragus can be in a shotgun type of configuration. As the skin stretches back, you can get a pull on the tragus, kind of opening up that region. And other times you have extra skin that's laid over the tragus, so it kind of looks like a bit of a pancake type of appearance in front of that tragus. So I'm seeing some of those changes here. It also appears that some of that cheek filler that she's been getting over those preceding years has really built up, and so now there's basically an elimination of the perioral boundaries. So the mouth region that's supposed to be separate from, say, the cheeks is now a kind of a fused zone, and so you don't see those clear boundaries. And something else that I'm seeing here is that as the cheek starts to come down towards the perioral region, it starts to weigh down on the lateral portion of the upper lip, and that can bring the corners of the mouth down, increasing also the upper lip arch. We have a video on frowning and things that can make the mouth appear more frowny. And this is a more rare type of cause, I would say, where the medial cheek filler is starting to extend into essentially the upper cutaneous lip, creating a bit more of that arched appearance. In 2022, at the age of 60, I think that perhaps Demi is starting to reduce the cheek filler volume that she had, and this is giving her a bit more of a natural appearance once again. And in 2023 and 2024, I don't see any other major changes. The total cost of these potential facial plastic surgery procedures is $285,000. In a 2010 interview, Donatella said the following when asked about a natural look for women. "I don't even know what my natural color is. Natural? What is natural? What is that? I do not believe in totally natural for women. For me, natural has something to do with vegetables." But has plastic surgery played a role in Donatella's changing appearance? As always, estimated costs of potential procedures are included at the end of the video. In approximately 1980, at about the age of 25, when you look at Donatella's nose, you can see that there's a slight dorsal hump or a small convexity at the top of the bridge. When I look at her lips, I notice that her philtrum is relatively short. She also has a full upper lip that's slightly smaller than her bottom lip. And when you look at her upper lip, you can notice that the red portion of the lip extends all the way out to the oral commissure. Some people have a very different anatomy where the cutaneous portion of the lip essentially hangs down, and when you go out to the oral commissure from the cupid's bow, you start to lose the red portion of the lip. Donatella also has a very strong jawline, which is an observation that I often make in many of these celebrity analysis videos. In 1981, at the age of 26, what you can see here is that Donatella has proportional horizontal thirds of her face. So when you look at the hairline down to the top of her nose and then compare that to the top of the nose to just under the bottom of the nose, and from the base of the nose down to the base of the chin, those thirds are relatively equal. You can see that at the age of 26, Donatella already has some glabellar rhytids. She also has some visible under eye hollowing and slight nasal tip bulbosity. In 1984, at the age of 29, I see no change. And in 1988, at the age of 33, I also see no change. In 1989, at the age of 34, what I notice here is that Donatella has full brows. And that was in vogue more in the 80s, and it is more in vogue now. But as people entered into the 90s, they started to go for that more thin eyebrow look, and you'll see that coming up with Donatella as well. Fashion seemed to shift more to an emphasis on thin. Minimalism and grunge aesthetics became more of the norm in the 90s. In 1990, at the age of 35, I'm seeing that Donatella's glabellar rhytids are now more etched in. So when she's just at rest, you can see that those vertical lines are more prominent. She also has increased upper eyelid hooding. And I'm noticing reduced cupid bow definition compared to about 10 years prior. As we get older and we lose integrity in our tissues, the vermilion roll of the upper lip flattens. And while people make attempts to recreate that roll using filler, it's oftentimes not an exact match to the original roll. And when you inject at the vermilion border, as many of you know from prior videos, that filler can migrate into the cutaneous lip and it can increase that appearance of duck lips. So it's very difficult to recreate the vermilion roll once it's been lost, and also to adjust the contour of the cupid's bow can also be difficult. In 1991, at the age of 36, I see no change. And in 1992, at the age of 37, this goes back to what I said previously about eyebrows becoming thinner in this decade, and the same holds true for Donatella's appearance. Other than her eyebrows getting thinner, I'm also noticing that her lips appear fuller. Specifically, the upper lip has taken on a fuller look, and this could be due to silicone microdroplet injections. Silicone was first used in the lips back in the 1960s, but in the 80s and 90s, a fuller upper lip compared to the bottom lip became more in vogue, and that's when silicone started to make a resurgence. Because remember that HA filler was not widely available at that time, nor was it FDA approved for any indications on the face. One of the issues with silicone in the lips is that there's no antidote to reverse that material. Silicone starts to integrate into your tissues, and it can cause inflammation and become embedded in the tissues. So when we do surgery on tissue that's had silicone injected into it prior, when we're in there, we're not exactly seeing particles of silicone, but we're removing portions of tissue that likely contain silicone or some of the inflammatory swelling that it created and the scar tissue that may have formed around it. In 1993, at the age of 38, I see no change. In 1994, at the age of 39, I wanted to point out here that the rhytids or wrinkles are becoming more obvious in a static form. So when she's just at rest rather than animating the face. And you can see that in the glabellar area, you can see that in the crow's feet, and you can see it in the under eye region. Remember that Botox has heightened risk when injecting into the lower eyelid, specifically as it relaxes some of the muscles of the orbicularis oculi muscle. It can cause ectropion, which is essentially a lowering of the eyelid, and what that can lead to is dry eyes. So one needs to be very cautious when considering injecting the lower eyelid with Botox. In 1995, at the age of 40, I see no change. In 1996, at the age of 41, I'm observing here that Donatella's eyebrows are starting to look heavier and the brows have descended to some degree. As eyebrows drop down, what we start to notice is a crowding of the upper eyelid, and that supratarsal platform starts to become less visible. Even if you don't have extra skin of the upper eyelid, the brow sitting lower can start to create that type of upper eyelid crowding. And for some people, it can get so bad that they actually have difficulty seeing, and part of their visual field might be impacted by that extra tissue. So some brow lifts and blepharoplasties are not just for cosmetic purposes, but actually to be able to see better. Just like with rhinoplasty, some people get it just to look better, and other people are trying to breathe better. Same thing with brow lifts and blepharoplasties. Some people are just trying to see better, while some people are trying to balance the functional with the cosmetic, and yet other people are just seeking out cosmetic improvements. In 1997, at the age of 42, I'm seeing some signs here of a potential brow lift and blepharoplasty of the upper eyelid. I think it's important to bring up here that brow lifts are not just to lift the brows. They also can help with reducing the wrinkles or the static lines that we have on our forehead. And that could be the glabellar area, that can be those horizontal lines of our actual frontalis muscle. So before the days of Botox, this was a very popular choice, doing a brow lift to simultaneously elevate the brows, but also to smooth out the contour of the forehead. And if you look at Donatella's forehead and glabella, I think you'll appreciate that they're much smoother now than they were even the year prior. But one of the issues with performing a brow lift and a blepharoplasty is that you can start to create more hollowing in the upper eyelid area, and that can actually create a more aged appearance. So one needs to be careful not to remove too much skin of the upper eyelid. And when that combination of procedures is performed, brow lift and blepharoplasty, typically the brow lift is performed first, and then you see if there's any extra skin left after the brows are lifted. And oftentimes there's not that much more skin to remove. Sometimes there's some skin to remove, but usually the brow lift alone can correct a lot of the heaviness that people experience in the upper eyelid area. In 1998, at the age of 43, I see no change. And in 1999, at the age of 44, I also see no change. In the year 2000, at the age of 45, Donatella's upper lip is now looking fuller. And I think that there are three potential reasons why this might be. The first is that maybe she's had additional rounds of silicone again injected into the upper lip. Another possibility is that perhaps she started to get some HA filler placed into the lips. Remember that Restylane was the first FDA approved HA filler, and that was back in 2003, and specifically for the nasolabial folds. but of course people were using it for other areas as well. And the third possibility is that perhaps this was still the previously placed silicone that was causing some persistent inflammation and lip enlargement. One of the main indications for a lip reduction is actually a history of silicone injections. Silicone tends to migrate and expand various regions of the lips over time, and there comes a point where some people feel that their lips have too much volume and they might seek a lip reduction for that reason. In 2001, at the age of 46, I'm noticing here that Donatella is starting to have more prominent platysmal bands. This is one of the more superficial muscles in the neck, and it extends onto the lower face as well. This is one of the main muscles that's manipulated during a facelift surgery. And Botox was recently FDA approved for injections into the platysmal bands, and that can be effective in softening this muscle to a degree. But remember that with Botox injections into the platysma, one must be careful with the dose that's applied because it's in the neck, and other structures in the neck control things like swallowing, speaking, and breathing. So if you inject too much Botox, you could have migration into these more critical structures that are controlled by their own muscles, and if you weaken them, then you could have some pretty bad consequences. In 2002, at the age of 47, I'm noticing that if you look at Donatella's lower jaw, you can see some jowling forming there. And jowling is caused by the cheek starting to descend with the aging process. And there are ligaments in the face that prevent structures from going into other zones. So in this case, for example, there's the mandibular ligament, and the cheek is not able to go any more medial than this ligament that's holding it back. And that's why you start to see that bunching forming in that location. Some people try to use some filler to fill more medial to the jowl to smooth out the contour of the jawline. Of course, another way to address this is with surgery with a lower face and neck lift. And of course, many people choose to leave this untouched. This is a very normal part of the aging process. In 2003, at the age of 48, what I wanted to point out here is that Donatella's lips appear to be changing. They appear less defined. And we're starting to see fullness of the upper cutaneous lip as well, and that becomes very difficult to correct. There are procedures like we talked about for the red portion of the lip, for example with lip reductions, but to try to reduce the volume, especially with a non-HA filler material, of the cutaneous lip is very difficult to do. And there really aren't any great surgeries to accomplish that task. So the best thing to do is to try to prevent it from ever happening in the first place. In 2004, at the age of 49, I see no change, and that's the same through 2007. In 2008, at the age of 53, I'm seeing some signs of cheek implants. These have now added some fullness to Donatella's lateral cheek. Previously, most of the fullness in her mid-face was at the medial cheek, and now you're seeing some extension of that fullness going more lateral. She also has reduced lower lid hollowing, and that could in part be due to a malar implant. Cheek implants are often designed to reduce that hollowing of the lower eyelid as well. And I think that given her fuller lips, the cheek implants provided some better facial balancing. Sometimes I find that cheek implants or filler injected into the cheeks can take away a lot of attention from the rest of the face. But if you have other structures that could balance against the new implants, then potentially the face can still retain some degree of harmony. And in 2009, at the age of 54, I wanted to point out in these images how well demarcated, in my opinion, this implant appears. You can really see its lower border quite well. Compare these images, for example, to Donatella in 1998, and you can see that stark contrast. In 2010, at the age of 55, I see no change. And in 2011, at the age of 56, I am seeing now some indication of a potential facelift. Even though the area around the ears is difficult to assess because Donatella frequently wears the hair sort of down over the ears, what we see is that the jawline appears tighter. There's less of the jowling that we saw previously. And this degree of contouring is difficult to achieve with non-surgical modalities. In 2012, at the age of 57, I see no change. And in 2013, at the age of 58, I also see no change. In 2014, 2014, at the age of 59, what I'm noticing is that Donatella wears a lot of eyeshadow, and with her lighter eyebrows and the lighter hair, you would think that most of the attention would then go to the eyes. But given the lip volume that she has, a lot of the attention when I just look at her face still travels, in my opinion, to the lower face first. And that is in large part due to the volume of the lips. They attract a lot of the attention. In 2015, at the age of 60, I see no change, and that's the same through 2017. In 2018, at the age of 63, it looks like Donatella may have had a rhinoplasty around this time. To my eye, the hump is no longer there. Also, the bridge and the tip of the nose appear to be narrowed. But her nose looks overall smaller, not bigger. Remember that if it was filler that was used to straighten out the bridge of the nose actually gets bigger, because that's the only way to make it straighter. You add some filler above the hump and below the hump, and that's going to create a larger nose. But in Donatella's case, the nose appears smaller, and the only way to do that is typically with surgery. If you're looking for the Versace of skincare and hair care products at affordable prices, make sure to check out feelconfident.com. It's quiet luxury at its best. And it's my brand, and we really appreciate the support. So please show my team how much you love the products and go check them out for yourselves. One standout product is our HA serum. Like all of our products, it's intelligently formulated. It has high molecular weight and low molecular weight hyaluronic acid molecules to balance hydration with the depth of penetration. So everything's been thought through with these products, and overall the feedback so far has been amazing. Thank you all for trying it, and if you haven't yet, make sure to go check it out for yourself. In 2019, at the age of 64, I see no change, and that's the same through 2022. In 2023, at the age of 68, I think that Donatella may have had a cheek implant revision, changing out her old cheek implants for slightly larger ones. I'm also seeing additional fullness and further demarcation of the lower jaw, and I think this may be because of some gonial angle implants as well. Those are intended for the angle of the mandible, and they go right over the lower jawbone. This has stretched out her face into a more square configuration. Her face appears less long and now a bit wider. It has also given her face more structure onto which the skin can be draped, so the tissues actually appear a bit tighter and less droopy. In 2024, at the age of 69, I think Donatella may have had a brow lift revision around this time. When you compare back to say 2020, you can really see that the eyebrows again appear more elevated. I know that when people saw some of the recent pictures of Donatella, they thought that a lot more had gone on in the last few years. And as I've tracked back, decades, I'm seeing that recently not too much has changed other than maybe this brow elevation that I'm seeing. But otherwise, I don't think too much more has changed. But lighting and angles as well as photo retouching can really change our perception of how someone's face appears. Case in point, when Donatella went to the Devil Wears Prada event on December 1st in 2024, she then released certain photos, and those photos look quite different depending on which photo you look at. This first photo, you can see her looking up, so the jawline is going to appear tighter, and there's going to be less visibility of the neck with the way that the light is falling. It looks like the photo may have been retouched because the skin is just so smooth and glistening, and that of course adds to a lot of youthfulness as well. And then with the restructuring of her face over time, especially the bony anatomy with the potential implants, you see that kind of width to the face, so it overall looks quite youthful. Now in this other photo taken on that same day, you see quite a different picture. I mean, she still looks very youthful for 69, no doubt, but now you're really seeing the details of her skin, and you can see that of course there are some more wrinkles, and that's what you would expect to see on a person in their 60s. But you can really see that the texture is quite different compared to the last photo we looked at. You can see that the neck doesn't appear quite as smooth. Some of those platysmal bands are present. You can also see some of the irregularities in the lip itself from some of the treatments that we talked about in this video. So I think Donatella still looks beautiful regardless of which of the photos you look at, but you can see that each photo tells a slightly different story. and the total cost of these potential plastic surgery procedures is $190,000. From her early days on Gossip Girls to her recent roles in It Ends With Us and Deadpool and Wolverine, Blake Lively has long been admired for her looks. But as time has passed, many have wondered if her evolving look is purely natural. Today, we'll explore her journey, examining whether these changes are a result of natural aging, makeup techniques, or perhaps even plastic surgery. All estimated costs are revealed later on, so make sure to stick around till the end of this video. In 2006, at the age of 19, what we see here is a natural hairline asymmetry. So Blake's right side is higher than her left. And this is actually the case for about 90% of people. It seems like just like people are right hand dominant, so too, the right side of the body tends to be the higher side or the bigger side, meaning that the bone itself tends to be a bit more expanded than on the left. Blake also has a widow's peak, which is that central portion of the hairline that dips a little bit lower than the surrounding hairline. She also appears to have some upper lid hooding. We call this dermatochalasis when there's an excess amount of tissue in the upper eyelid. Some people are born with this, and some people develop this excess skin later in life with the aging process. When we look at her nose, we do see some nasal tip bulbosity, and there's a slight droop to her nose when she smiles. When I compare back to photos of her in high school, what I'm seeing is that she still has some width to her nose, but the tip looks more narrow and less bulbous than it did back then. So this suggests a possible rhinoplasty surgery, in which the nasal tip was subtly narrowed to not deviate too far off from her original nose, but to give her some additional contouring and to take some attention away from her nose and for the focus to be on other features of her face. When I look at Blake Lively's lips, what I'm seeing here is that she has a short philtrum, she has a thin upper lip, and she has some gum show when she smiles. She also has a strong chin, and as we've seen in many of these videos, this is common in Hollywood for both women and men. In 2007, at the age of 20, what I'm seeing here is a youthful transition from her lower eyelid to her cheek. And over time, as we age, there's either a hollowing that develops, and that is often called a tear trough, or there are eye bags that form, and this is from pseudoherniation of the lower eyelid fat. She also has some prominence of the orbicularis oculi muscle. This can sometimes be confused with the tear trough deformity, but in reality, this is just some prominence of the muscle, not the appearance of a classic tear trough. In 2008, at the age of 21, we see some signs of early forehead wrinkles. And remember, there are pros and cons to starting Botox early. One potential advantage is that you can prevent deeper lines from forming later in life. But there are some real disadvantages as well. This can include a behavioral dependence on the medication, where to maintain a certain look, you need to keep going back and getting the Botox re-injected every 3 to 4 months. Some people need higher and higher doses as they become partially resistant to the medication, and some people need to completely switch to a different neurotoxin because potentially the first one that they were on is no longer effective. There is also a real cost that comes with getting these injections several times a year. And remember that the forehead is the only muscle, it's called the frontalis muscle, that actually elevates the eyebrows. So if you keep knocking it down with a neuromodulator and a paralytic essentially like Botox, what happens is that the eyebrows can gradually start to descend or droop over time. I also see some signs of potential lip filler in Blake's upper lip. You can see some potential migration into the cutaneous portion of her upper lip. So that's the area just above the vermilion border. Oftentimes with lip filler, people are injecting into the vermilion border, and that tends to create some migration or some spillover into the cutaneous portion of the lip. And that's what actually leads to that duck lip appearance. In 2009, at the age of 22, in this photo, we're really seeing the M-shaped hairline that Blake has, with that left side being lower than her right. When I look at her eyes, something has changed. It looks like the supratarsal crease is now more visible. Now, this doesn't typically happen on its own, so it does suggest a possible upper blepharoplasty surgery. To me, there are no obvious signs of a brow lift. Sometimes a brow lift can be combined with an upper blepharoplasty, but sometimes people get just a brow lift or just an upper blepharoplasty. So it's important to look at the actual eyebrow position to see if something has changed. In my opinion, Blake's eyebrows are in the same position as they were previously, but there is more of an opening to the upper eyelid, and I think that might be from an upper blepharoplasty. When performing an upper blepharoplasty, it's important for the surgeon to not extend the lateral incision beyond the lateral orbital rim, because that healing tends to be worse and that scar can be more visible. Also, when performing an upper blepharoplasty and working more centrally, it's important to avoid a webbed scar, which that area is susceptible to. In 2010, at the age of 23, I see no change. In 2011, at the age of 24, I also see no change. In 2012, at the age of 25, when we look at Blake on repose, which is when she just parts her lips like this, what we're seeing is at least 4 of the upper teeth. Now, as you guys may know, some people have no upper tooth show when they just part their lips, and other people show some teeth, and other people might show just the central incisors, which is just 2 teeth, yet other folks have at least 4 teeth that are visible, like in Blake's case. And this creates a more youthful, potentially a more sensual appearance as well. And that is why lip lift surgery is quite popular, because it's really the only procedure out there, other than maybe some cosmetic dental work, that can expose the upper teeth more when you just part your lips. Blake also has a strong philtral definition. And as we've talked about in other videos, it's very difficult to recreate this with any type of procedure, including fillers. So this is something more that some people are just born with, and others have a flatter configuration to their philtral area. In 2013, at the age of 26, I'm seeing some signs of nasal tip bossae on the left. These are knob-like protuberances of the lower lateral cartilages. These can arise soon after a rhinoplasty, or they can arise later on, like years later. Usually when it occurs years later, it's because of some scarring and scar contracture that leads to these different types of prominences on the tip of the nose. Because think about it, as you're doing a rhinoplasty, you're having to sculpt those cartilages. Sometimes that means suturing them up and creating some folds. Other times you're actually cutting through part of those cartilages, and sometimes that can create these protuberances. And in Blake's case, as I look back at some of the older photos, I'm seeing that those bossae were there soon after her potential rhinoplasty. And I wanted to point out here that sometimes people mistake a revision rhinoplasty for just changes that have occurred long after a single primary rhinoplasty. Those are 2 different things. So some people get multiple nasal surgeries, and obviously you start to see different changes that may have occurred between the different surgeries. And other times they maybe had 1 surgery, but now the effects of that surgery and the appearance of the nose has been changing over time. And for some reason, a lot of people think that with a rhinoplasty, there are no changes that happen down the road, let's say 5, 10 years out, or even further out. Whereas with like a facelift, people seem to accept that after many years, you're going to have some drooping to the face again, right? That we accept, but we don't really accept that the nose can continue to change. But in reality, it does. So even after a single rhinoplasty, say earlier in your life, when you're 10, 15, 20, 40 years older, of course your nose is going to look somewhat different than right after the actual rhinoplasty that you had many years ago. And then again, of course, there are people who get revision rhinoplasties and even tertiary revision rhinoplasties and sometimes many more. So distinguishing between those various types of effects is sometimes difficult, but an interesting exercise nonetheless. So now in 2014, at the age of 27, I am seeing some signs of a potential revision rhinoplasty. The tip of her nose appears smaller, and it appears that she has a more pronounced supratip break. That's that area right over the tip of the nose that appears to indent a little bit and then come back up into the bridge of her nose. And also the bridge of the nose appears more narrow. That to me suggests that she underwent a potential second rhinoplasty to further reduce the size of the tip of the nose and narrow the nose overall. And you can see how different her nose looks now on the 3/4 view compared to prior. In 2015, at the age of 28, I'm seeing some signs of the start of Botox treatments to the common areas, the forehead, the glabella, crow's feet. Starting neuromodulator treatment in our late 20s is fairly common these days, and we can argue all day whether or not someone needs it, but that is a fairly common time to start these injections. There's always this balance, as we talked about earlier in this video, between starting too early but also waiting too long potentially to have more etched in lines that are more difficult to erase with neuromodulator treatment. In 2016, at the age of 29, what I'm noticing overall is that the changes that we're seeing with Blake's appearance have been gradual, incremental, and are non-dramatic. This leads to a more natural look that is less noticeable. It's cases like these that give plastic surgery, I think overall, a pretty good rep. And it shows you how powerful subtle changes can be, and that you don't need to undergo 10 surgeries all at once to look better. And oftentimes, those dramatic transformations can actually look a lot less natural and a lot more disfiguring than someone who undergoes some subtle changes gradually as they age. In 2017, at the age of 30, what we're seeing here is the slight descent of Blake's lateral eyebrows. Now that she's in her 30s, this is a very common thing that happens. There's a weakening of the lateral portion of our face that occurs lateral to the temporal crest. There's less support in this region, and that leads to the area starting to droop. And even though 30 is still young, that is a common time when we start to really appreciate the aging process. And really, many people in their mid to late 20s start to notice that there are some signs of slow facial descent. In 2018, at the age of 31, I see no change. In 2019, at the age of 32, you can see how beautiful Blake's skin is, and this really makes a big difference in her overall appearance. There's almost this glowing shine that she has, and that stems from good skincare and also sometimes procedures such as laser resurfacing or microneedling, or sometimes even with PRP treatments, and regular facials that can help give your face an added brilliance. Some people ask me about my own skincare routine, and I talk about it in the video below, so check that one out. But in case you're wondering, I use these amazing Feel Confident products. In 2020, at the age of 33, what I'm seeing is that Blake is now sporting a fuller eyebrow than she did in her teen years. It's become more in vogue to have a fuller brow, and I think she has mostly her natural hairs with maybe some makeup and tattoo enhancement in the body of the eyebrow. Remember that the eyebrow has 3 main components to it. It starts with the head of the brow, then you have the body of the eyebrow, and then the tail of the brow. In 2021, at the age of 34, I wanted to compare this frontal photo to a photo of Blake from her prom. What we see is that Blake now has these fuller brows. Her eyes also appear to be more open, and this could be from the upper blepharoplasty that she had. Also, her nose is thinner, and this brings attention more to her eyes, plus the thicker eyebrows also helps focus our attention on that eye area. And Blake has a fuller upper lip, and this brings some additional facial harmony and balance, and also it helps reduce the appearance of her gum show. She has what looks like some slight forehead Botox, but it's not too strong or harsh. These small changes really add up, as you see in this photo comparison. In 2022, at the age of 35, I see no change. And in 2023, at the age of 36, I also see no change. In 2024, at the age of 37, what this frontal image of Blake reminds us of is that we all have facial asymmetry, and in Blake's case, the right side tends to be a bit higher than her left. You can see that she has more right frontotemporal recession than the left-hand side. You can also see that her right eyebrow is higher than the left, and her right eye sits at a higher level compared to the left side. Asymmetry within limits is normal, and it should be something that we embrace rather than frown upon. And the total cost of these potential facial cosmetic procedures is $125,000. From soap operas to Real Housewives of Beverly Hills, Lisa Rinna has been in the spotlight for many years. Has plastic surgery played a role in her changing appearance? Estimated costs of potential procedures are provided at the end of this video. In 1989, at the age of 26, you can see here that Lisa has a prominent widow's peak, and that's the area right at the center of the hairline. It's a slight projection down that gives the hairline a characteristic look. She has about equal horizontal thirds of her face. Her eyebrows are arched closer to the lateral canthus of the eye. Usually the most arched part of the eyebrows occurs between the lateral limbus of the eye and the lateral canthus of the eye. She has nice supratarsal show, and her nasal tip to me appears more narrow than it was in high school. When we look at photos from her in high school, there is a bit of a tip bulbosity, and when you follow the bridge of the nose from the top down towards the tip, you see that there's a bit of a splay as you get to the tip. In these more recent photos, I don't see that same effect. So I wonder if she had a rhinoplasty sometime between high school and age 26. This would have been to make the tip more narrow, to have a more uniform width to the nose from the bridge down to the tip. Lisa appears to have full tooth show on smile, and she has a strong jaw structure. In 1991, at the age of 28, Lisa's lips do appear to be fuller. She did admit to silicone lip injections sometime in her 20s. This would have likely been with a micro droplet approach, where these small injections of silicone are placed into the lips over several sessions to start to build up their volume. Keep in mind that there's no dissolving agent when it comes to silicone, so it's not like the currently used hyaluronic acid fillers that you can dissolve with hyaluronidase if you're not happy with them. With the silicone injections, you're pretty much stuck with them unless you go and cut them out. And the silicone injections can look good initially, but then what happens is that they create a lot of distortion in the lips later on. And we have more on that later in this video. In 1992, at the age of 29, what I'm seeing here is progressive enlargement of Lisa's upper lip. Now, this was likely due to the several sessions of silicone that she has admitted to having. With each subsequent injection session, the upper lip became fuller and fuller until her desired appearance was reached. It also looks like Lisa may have had a chin implant around this time. Her chin appears to protrude down more, and it's now more narrow compared to her original chin. In 1993, at the age of 30, I see no change. In 1994, at the age of 31, what I wanted to point out here was that her upper to lower lip ratio used to be about a 1:3, whereas now it looks like that ratio is closer to a 1:1. So the upper lip appears to be of a similar size to the lower lip. Now, while that is a ratio that does exist in nature, most people have a bottom lip that's a bit fuller and larger than the upper lip. That's a more classic presentation of lips, and also a more classic understanding of beauty standards, even though those standards are somewhat changing, and they continue to change over the years. In 1995, at the age of 32, I'm wondering if Lisa may have had some implants placed into the jaw closer to the gonial angles. So previously I mentioned there may have been a chin implant placed, but now what I see is there's additional width to the lower face. And the whole architecture of the lower face to me appears to be changed compared to prior. It was a much smoother transition up from the chin to the side of the face, and now there's a bit more of a boxy type of appearance, and it looks like maybe there's been some prominence added to the gonial angles, and the material that would have been placed at that time was most probably still silicone. Silicone chin implants have been used since the 1950s. In 1996, at the age of 33, I see no change. In 1997, at the age of 34, what we're seeing here is a continued change of the upper lip. The shape shape is now appearing to have a lateral prominence. So the portion that's out to the side on both sides seems to be more full and seems to be hanging down more. And you can even see how it covers up some of those upper teeth. And in 1998, at the age of 35, I see no change, and that's the same through 2000. In 2001, at the age of 38, again, looking at the upper lip, there's irregularity at the wet-dry junction. So previously we were seeing just a fullness forming on the lateral aspects of the upper lip, but now we're seeing this irregularity developing. And that's again related to the changes that occur with silicone injections as time passes. In 2002, at the age of 39, this may have been around the time when Lisa started to get Botox injections. Botox became more popular in the early 2000s. So areas like the forehead, the glabella, and the crow's feet are the most commonly injected zones, and it looks to me like Lisa has a fairly frozen forehead, glabella, and crow's feet. With facial expression, you really don't see much movement in those areas. And in 2003, at the age of 40, I see no change, and that's the same through 2005. In 2006, at the age of 43, I wonder if Lisa had cheek implants placed around this time. There is now more medially and laterally based volume in her cheeks, and there's more of a blurred lid-cheek junction. Some people place these malar type of implants or submalar implants. As those implants are placed, it reduces that lid-cheek transition. You see less of the tear trough as that implant is placed to push those tissues up. Other ways to reduce the appearance of the tear trough include placing filler and also a lower blepharoplasty that can take the fat and reposition it over that trough. And yet another way is with a fat transfer to again blur that transition and reduce the trough. And in 2007, at the age of 44, when we compare back to 2003, you can see, especially on this right side, the lateral cheek is now protruding more. So there's an architectural change there that I don't think is explained with just fillers because of how regular that shape is, especially bilaterally. So I think that shape may have been due to the placement of a cheek implant. In 2008, at the age of 45, I see no change. And in 2009, I also see no change. In 2010, at the age of 47, Lisa did admit to an upper lip reduction. She was very public about this, and this is a surgery that I do in my practice, and this is something that I do for patients with a history of silicone lip injections, but also people who were just born with one part of the red portion of the lip being a little bit more full than the other, or they may have had prior traumas or other types of surgeries that may have left them with an area of prominence that doesn't look in sync with the rest of their lips. So for those patients, we do an upper lip or a lower lip reduction where we're basically removing the portion that's sticking out. And with silicone specifically, what patients think is that I'm going to go in there and I'm going to see every little speck of silicone. And that's just not the case. We're really not seeing the actual silicone. We're just seeing the areas of prominence, and we're going after those areas and removing just the right amount of tissue so that we can create more evenness and a smoother type of junction right at the wet-dry area of the lip so that it doesn't look like there's extra tissue. Also, some patients report that when they have that kind of tissue prominence, they might be biting on that tissue and that tissue gets irritated and then it actually grows even more. So it could affect even things as basic as eating. So sometimes a lip reduction is done for functional purposes and other times it's done for just aesthetic purposes, and sometimes it's both. So that's something to keep in mind with lip reduction surgery. And I use dissolvable sutures, so there's nothing that has to be removed. And it's overall a very reproducible, consistent, and a high satisfaction type of procedure. In 2011, at the age of 48, I wanted to point out here the philtral column definition that Lisa still has. And even though she's in her late 40s now, that definition persists. Because in many patients, when they're younger, it's quite defined, the Cupid's bow, the philtral columns, and as we age, we lose that definition. But in her case, it's still there. And the reason why it's really difficult to recreate with non-surgical or surgical types of methods is because the primary reason why you're seeing the definition is because the central portion of the philtrum is actually depressed, or it's indented, right? It's concave. That's what you're seeing as far as the definition, rather than the columns being so high up and protruding up. And so that's really where the difference is. When you do a surgical approach to try to recreate the columns, or you inject it with filler, you make those lateral columns stand up, but the center is still quite flat and in line with the tissue around it. The trick is to have that depression, and that's very difficult to create, right? So if you have it naturally, great. If you don't, then you're kind of stuck. In 2012, at the age of 49, I am seeing some signs of a potential brow lift with or without an upper blepharoplasty. There's now increased supratarsal show, and there's increased hollowing of the upper eyelids. And these are some of the unintended effects of brow lifting with or without blepharoplasty, because you're essentially creating more space in this region. And yes, you want to remove excess tissue, but it's actually quite easy to remove a bit too much and then have this type of hollowing, and also have an increased platform here. And usually it's not a big deal, and few people will realize it. And in Lisa's case, I think the area still looks extremely natural, and it was well done. The brows weren't lifted too much, and not too much skin was removed from the upper eyelid, but yet there is a change there, and I can appreciate that compared to prior images. In 2013, at the age of 50, Lisa's upper lip appears to have returned in its lateral fullness. So even though she had the lip reduction procedure 3 years prior, now what you're seeing is essentially a return of that tissue. And that is something that we see with lip reduction surgery, especially when it's done for a history of silicone injections. That silicone can continue to migrate around, and the tissue continues to form, like scar tissue and other nodules. And then you get this relapse tissue that, again, to resolve, you would need to go back in and do another lip reduction. In 2014, at the age of 51, I see no change. In 2015, at the age of 52, I do see some signs of jowling forming, and also there's now increased submental laxity. So that's the tissue of the neck as we start to see the effects of gravity and of general volume loss in the face. The tissues tend to sag, and that's where you start to see this kind of crepiness in the neck and additional platysmal banding forming as well. In 2016, at the age of 53, I see no change. In 2017, at the age of 54, what it looks like to me is that now the upper to lower lip ratio is closer to 1.5 to 1. Now the upper lip is really larger than the lower lip, and part of this has to do again with the history of silicone injections despite having had the lip reduction, and part of it is that our tissues continue to atrophy with time. So that bottom lip is starting to see a reduction in volume, and yet that upper lip is still having that fullness from those injections and the scar tissue that had formed. So now you have this discrepancy of that upper to lower lip ratio. In 2018, at the age of 55, I see no change, and that's the same through 2020. In 2021, at the age of 58, I do see some signs of a potential facelift. So there's now reduced jowling, the neck skin appears to be tighter, and when I compare back to say 2004, when you look at the sideburn area, there's less hair there than there was before. And that's another sort of giveaway for facelift procedures. So in addition to some of the tragal changes that we talk about, some patients will have a reduction in the sideburn hair. And that's because as the incisions are made to remove that excess skin during a facelift, some of that skin will carry with it some of those sideburn hairs. They're usually removed because it's hard to hide the scar in those finer hairs. So the scar is hidden in the temporal hairs. But as you do that, along with the skin that you're removing, usually those sideburn hairs go as well. Keep in mind that if those hairs are lost, you can recreate the appearance of a sideburn with a hair transplant. And that is something that I do in my practice for patients who've had facelifts in the past and they have maybe some scarring or maybe some lost hair. It could be here. It could also be in the back, depending on how the incision is created in the back. Some people lose hair down here, and that also is kind of a giveaway for a prior facelift. So some people will come in for a hair transplant where we can conceal those scars pretty well and restore the appearance of their hair. In 2022, at the age of 59, I see no change. In 2023, I also see no change. In 2024, at the age of 60, it looks like she may have had some fillers placed into different parts of her face, but also what I'm seeing is that there is some general fat reduction that's occurring. As that occurs, the implants, if we have facial implants, become more obvious because the fat starts to basically atrophy away around different parts of the face, and then the areas where we have implants, they stick out more. And Lisa was also public about her use of the Skin Vive treatment. This is a newer type of filler that involves a micro droplet injection of hyaluronic acid, similar to the micro droplet injections of silicone that she had in her 20s, but now this is a hyaluronic acid-based filler, so there is the potential of dissolving it, but it's basically marketed as a way to not increase volume of the face and just give it hydration that's long-lasting. But it is injected into the superficial layers of the skin, so it does have the potential to add some volume because hyaluronic acid is a sponge, so it's going to attract water and it's going to swell. So even though they say that it's not supposed to give you additional volume, what Lisa discovered and what many other people are discovering is that it does in fact increase that fullness of your face. If you want to hydrate your face but not have facial swelling or an increase in facial fullness, then you essentially need topical formulations of hyaluronic acid, so like a hyaluronic acid serum, for example. And there's a very good one at feelconfident.com if you want to check it out. By combining different molecular weights of hyaluronic acid, there are ways to still penetrate into some of the superficial layers of the skin and hydrate the surface without giving you that added volume. And the total cost of these potential procedures is $270,000. 10 years ago, Lisa was asked about her views on plastic surgery, and she said the following: "It's all about what makes you feel good. I don't care what you do. If it makes you feel good, do it. The judgment that we have on women is wrong, and if you want to do something that makes you feel better, go do it. And I'll just add this one thing: go do it as long as you're finding a safe and reputable surgeon." Christina Aguilera has dazzled audiences with her powerhouse vocals and captivating performances. Alongside her musical evolution, there has been ongoing speculation about changes in her appearance, prompting questions about the role of plastic surgery. Let's look at Christina Aguilera's facial transformation over the years. Estimated costs of potential procedures are provided at the end of the video. In 1999, at the age of 19, what we're seeing here is that Christina has a relatively short forehead. When you look at the upper third of her face compared to the middle third and lower third, the upper third seems to be the shortest third of her face. She also has a very symmetrical upper third. When you look at the eyebrows, the supratarsal show, and the leveling of her eyes, it looks like they're very much on the same level. This isn't the case for many people. She also has full, youthful cheeks and a thin upper lip with a short philtrum and gum show on smile. In 2000, at the age of 20, what we're seeing here is a strong chin and jawline. And this is a characteristic that we see in many celebrities and models, men and women, that we analyze on this channel. This feature is actually protective when it comes to facial aging because it limits the amount of neck laxity that we see in people over time. When the chin is weaker, the jowls and the rest of the lower face start to descend at a faster rate, and it becomes more obvious that there's facial aging occurring. When the chin is stronger, we see that oftentimes things look tighter and more lifted for a longer period of time. In 2001, at the age of 21, I see no change. And in 2002, at the age of 22, there appears to be some enhancement to Christina's eyelashes. Now, there are different ways to enhance the eyelashes. One is, of course, makeup, such as mascara, that can make the eyelashes look more prominent. Also, some people use false lashes, and that can, of course, make it look like you have fuller lashes. Some people are big proponents of brushing the lashes and also massages around the lashes to help them grow fuller, while others use topical medications such as Latisse or bimatoprost. This has been shown to increase the anagen phase of the hair growth cycle. There are also serums out there such as natural oils and peptides that can in some cases help the lashes grow more. And there is such a thing as eyelash hair transplants, but they're a bit tricky because sometimes when the hair grows out, it actually faces the cornea of the eye, and that can lead to various problems such as corneal abrasions. So we tend to avoid eyelash hair transplants unless it's being done for like cancer patients or burn patients, for example. And I'm noticing here that Christina is starting to overline her upper lip, and some refer to this as a lip lift that can just be done with makeup. But keep in mind there's also a surgical lip lift that we talk a lot about on this channel. And we have a recent video dedicated to lip enhancement options, both surgical and non-surgical, so make sure to check that one out. In 2003, at the age of 23, what I'm seeing here is that Christina has thinner eyebrows, and this can be just from plucking the eyebrows, but keep in mind that over plucking of the eyebrows can lead to more permanent alopecia of the brows. Some people thin out their eyebrows to give the illusion of higher set brows. But remember that if you continue to pluck or get threading done, for example, that can ultimately lead to a thinning that basically is permanently that way unless you cover it up in some fashion, such as with makeup, tattooing, or an eyebrow hair transplant. So be careful with what you do in your 20s because that can have ramifications into your later years, and you might regret some of those early aesthetic decisions. In 2004, at the age of 24, I see no change. In 2005, at the age of 25, it looks like Christina may have had veneers around this time. It seems like her central incisor gap is now closed and her teeth appear more symmetrical. And in 2006, at the age of 26, I do see some signs of a potential upper blepharoplasty or upper eyelid surgery. There is now increased supratarsal show and a bit more hollowing to the upper eyelid region. And this to me appears sustained in more recent photos as well. The irony with upper blepharoplasty is that people get this procedure to look more awake and for their eyes to be more open. But sometimes when an upper blepharoplasty is, say, overdone, it can lead to more hollowing of the upper eyelid, giving the face a more aged type of appearance. In 2007, at the age of 27, I see no change. In 2008, at the age of 28, it looks to me like Christina has her natural nose. There's a small dorsal hump and there's nasal projection that's balanced against her strong chin. If her chin were weaker, it would look like the nose was potentially over-projected, but because of the chin having good strength to it and good projection, now there's balance between the nasal projection, the positioning of her lips, especially her bottom lip, which is a bit more protruded than the upper lip, and then how that falls with the chin. When you draw a line along those features, it all works together quite nicely. In 2009, at the age of 29, I see no change. In 2010, at the age of 30, it looks to me like Christina may have started to get Botox around this time, and to the usual locations, such as the forehead, the glabella, and the crow's feet. Because by 30, I would expect her to have at least some degree of early static lines, and especially she should have some dynamic lines on the forehead when animating. And I just don't see any signs of that. So that to me suggests that she's already starting to get a neurotoxin injected into those areas. And more recently, as Christina has started to endorse Xeomin, which is a neuromodulator, she has started to be a bit more open about getting these types of injections, though that relationship is much more recent. I think the early signs of neuromodulator dates back to around this time in 2010. And in 2011, at the age of 31, there appears to be more facial fullness. This could be because of just general weight gain, but it could also be because of filler to the lips, the cheeks, and the under eye area. You can see that her lip shape has started to change. There's now more arching. The cupid's bow and the philtral columns appear more defined. And to me, it appears that it's most likely the effect of filler rather than, say, a surgical lip lift, because the philtrum itself does not look to be any shorter. In 2012, at the age of 32, I see no change, and that's the same through 2016. In 2017, at the age of 37, I do see some signs of lip filler migration. So getting any kind of lip filler puts you at risk of having this type of migration. There are some ways, however, that you can at least attempt to prevent it. One way is to use smaller quantities. A lot of people will buy a syringe of filler and they expect that that syringe should be fully injected into their lips. But when that happens, oftentimes there's too much filler, and then that filler will eventually spill out of the pink part of the lips into, say, the cutaneous portion of the lips, and that's unfavorable. So it's better to start with smaller quantities and to do the injections less frequently. So not coming back every 2 to 3 months for your lip filler, but spacing it out as much as possible to limit the overall quantity of filler that's placed into the lips. Another way to reduce the migration of lip filler out of the pink or red lips is to not inject the vermilion border. Oftentimes it's a tempting place to inject because people are trying to recreate that natural roll that exists between the cutaneous lip and the red lip. But instead, if you avoid the vermilion border injections, you're less likely to get a spill out into the cutaneous lip. And with the continued use of facial filler, we sometimes see, like in Christina's case, a blunting of the nasolabial folds and the lid cheek junction. As you start to erase the natural boundaries of the face, things can start to look a bit more artificial. So it's normal to have a nasolabial fold that will separate the perioral area from the cheek complex, and to have some degree of a transition of a lid cheek junction here between the actual periorbital area and the cheek area. And when you efface all that with just dumping lots and lots of filler into the area, it starts to look like it's just like one thing, and that doesn't look totally natural. In 2018, at the age of 38, Christina is starting to have fuller eyebrows. And this could be because she just stopped plucking the eyebrows, so they are starting to grow in and appear fuller. It could also be because of the use of makeup. And some people end up getting a tattoo for the eyebrows, so it at least always holds a certain shape. Other people try something like microblading, which is also a form of a tattoo, but it's placed as like these streaks along the eyebrows to give it a more natural appearance. And yet other people choose to get an eyebrow hair transplant, where hair is taken from the back of the head and brought into the eyebrow area to actually bring a fresh supply of hair into the region. We have an entire video devoted to eyebrow hair transplants, so make sure to check that one out. Now in 2019, at the age of 39, I wanted to compare back to 2009, so 10 years prior, and let's see what some of these differences are. When I look at the upper third of the face, it still looks like Christina's original face. But when we start to look at the middle third and the lower third of the face, they appear much fuller than they did before. And we talked about the use of filler into the mid-face, but filler can also be used into the lower face to try to mask the appearance of jowling. So sometimes if it's overused, it can look like the lower face is starting to protrude a bit, almost like you have like a chin implant or like a jaw implant if it's placed along the bone of the jaw. Now, while it can be helpful for reducing that appearance of some degree of sag, it can also start to migrate as well, just like lip filler can. And as the lower face and the mid face get fuller, it again blends together and gives you a much fuller facial appearance that some people refer to as filler fatigue. And it's unclear if these effects were the result of HA filler being used or something like a fat transfer. Fat transfer, remember, is still another form of filler, but it's your own fat that's harvested, usually from the abdominal area, processed, and then injected into the face. About 50% of that fat won't survive. And while the fat transfer can lead to a more long-lasting result as far as the added fullness, it might also give you some effects that are difficult to reverse. So you could get little clumpy areas, and that
you can't reverse. There's no reversing agent for it. So you'd have to go in and actually remove surgically those little areas that might appear lumpy bumpy. Also, sometimes people get additional treatments of fat transfer to bring some additional volume into the face. So one round of fat transfer usually is not enough to sustain you for your entire life. And in 2020, at the age of 40, I wanted to point out here how important skincare is, because Christina's skin is always so vibrant. First and foremost, sunscreen is extremely important in protecting us against the sun, and not just preventing skin cancer, but also to prevent aging effects of our skin that are caused by the sun's UV rays. In addition to proper sunscreen or sunblock use, cleansing your face and moisturizing your face is also very important to giving you that pillowy, youthful look. And there are several high-quality skincare products available at feelconfident.com to leave your skin looking like the amazing skin that we see on many of the celebrities that we analyze on this channel. In 2021, at the age of 41, I see no change. In 2022, at the age of 42, I'm seeing some signs of a potential facelift, specifically with an endoscopic approach. And the reason I say that is because the tragus appears unchanged. You guys know that I'm always harping on the appearance of the tragus and how it changes with many facelift types. But with an endoscopic approach, when you're going more from a behind the hairline type of incision and you're dissecting from up there and getting into the deep plane, you'll oftentimes not affect any tragal change because you don't need to make this incision in front of the ear or behind the ear. When that incisional approach is spared, then there's no reason why the tragus needs to change. Other than the jaw tightening, another reason why I feel that maybe Christina had a facelift around this time is because of the increased space or the distance from the lateral brow to the hairline edge. When you look back at her photo from age 19, you can see how close those two areas are, the temporal area of the hair to the actual lateral eyebrow. As an endoscopic brow lift is performed, oftentimes that hairline goes back and that eyebrow doesn't necessarily move as much. So you have a tail of the eyebrow that's fairly fixed, and then you have this hairline that's pushing back, and that opens up this distance and can be a giveaway sign of an endoscopic facelift approach. Also, the lateral canthus of Christina's eye appears to be pulled higher, and that can also happen with an endoscopic facelift. This endoscopic approach is becoming much more favored for younger patients who don't have a ton of skin laxity. As we age and the skin starts to drop down and the tissues start to develop more laxity, in order to reposition those tissues, you do need to make an incision at least in front of the ear and sometimes behind the ear to resolve that excess skin, because when you go to lift, you'll have a bunching of skin. So in order to remove that bunching, that's where those incisions come in. But in younger patients where it's not so much that they have a lot of loose skin, making an incision up here behind the hairline is usually possible. In 2023, at the age of 43, I see no change. In 2024, I'm seeing the reversal of some of that facial filler. This could be from the use of, say, hyaluronidase that we know breaks down hyaluronic acid-based fillers. When trying to globally dissolve hyaluronic acid filler, I like to use a cannula approach. I do that in the lips, and I do that if I need to anywhere else on the face. And I dilute the Hylenex significantly to reduce the burn that some people feel, and also because hyaluronidase can at times thin out your natural tissue. So using it at lower concentrations and diluting it with like sterile saline is really beneficial for dispersing that hyaluronidase and doing it in a safe and effective way. In looking at some of Christina's recent photos, I'm noticing that she has overall lost weight, not just in her face, but in her body as well. And one thing that came to mind was Ozempic, since many people have been on Ozempic, celebrities and otherwise. And we have a full video on Ozempic, what it is, how it works, and specifically we discuss Ozempic face in that video, so make sure to check it out. In Christina's case, you can see the effects of Ozempic face. You can see it in her temples, you can see it in the orbits and in the cheeks. Everything just looks
much thinner, and there's a loss of that natural fat. And potentially also, she may have had that hyaluronidase placed to dissolve some of the old filler. So those two in combination create a very significant effect on the overall appearance of Christina's face. So now when we compare back to Christina in her 20s, what we see is that the upper face and the mid face are quite similar, but the lower face looks very different. And I believe that's primarily because of the lip area. There's been a huge change from her original lips to how her lips look now. And I think that's mostly the effects of lip filler and also the way that she overlines her upper lip. Keep in mind that even after you've dissolved lip filler, sometimes the lips still maintain a fuller appearance. It's like if you took a balloon and filled it up with water and then you take that water out. Usually the balloon is going to be larger than when you started before you even placed the water in. So too, the lips are very delicate and behave in a similar fashion. So even if the lip filler was completely dissolved, it's still possible that Christina was left with a fuller appearance to her lips. And the total cost of these potential procedures is $285,000. In Christina's words, "I am beautiful no matter what they say. Words can't bring me down. I am beautiful in every single way." This is something that we should always remind ourselves of. You can look and feel beautiful with or without plastic surgery. And that's the creed that we live by at Feel Confident as well.